Crazy, you can't park it out. I know. You throw it in and it's juicy.
I feel like the most expensive part of that is the seasoning. The seasoning's like $6.
$6-7. Yeah.
All right, guys, my plan here is to get away from PowerPoint really quick. Because everybody ready. So to get back into assessment, all right, to get back into hands-on, dealing with the mannequin and doing all that kind of stuff, right? That's the kind of stuff we need. Couple things, how I kind of see us doing this. Because, 31 of us, and what ends up happening is you got 4 or 5 people up here doing scenario, right? And 25 other people are just kind of screwing off. And so, and some of that I get. Some of us can't get up here, you're not part of it, blah, blah, blah. So to remedy that, I got an idea. Got an idea. And the idea is this. So we're already in squads, so we don't have to worry about grouping up, right? And so this is kind of the way I see it. One squad will actually participate in the scenario, just as we have before. But prior to the scenario, one squad will actually write the scenario. Okay? The war wagon loves this idea. Okay? But so one squad is actually going to write the scenario. One squad is going to be identified as a resource. Okay, so that resource could be medical control. That resource could be having the book in front of you. That whatever that resource is. So if I'm working a call and I need a question answered, I'm going to go to the resource squad. Right, whoever that resource might be, whatever squad that needs. Okay. So we got a squad that's doing the scenario, squad that's participating in the scenario, a squad that's resourced. All right. And then what we're going to have left over is a couple of squads. To make this a little more, keep everybody in check and participate in the scenario, I'm going to issue everyone a piece of paper. You're going to get a red piece of paper, like a card, a red card, and a yellow card. So if anyone sees something that's done, maybe they skipped a step, see it, you're going to throw the yellow card. You're going to throw the yellow card. If you see something that's dangerous to patient care that can kill the patient, you're going to throw the red card. Okay? So the yellow card will pause the scenario. I see a yellow card out there. We go, okay, everybody, slow down, hold on a second. We got a yellow card up. Let's discuss this real quick. Right? See what the yellow card's about. If a red card gets thrown up, we're going to stop the scenario immediately. And we'll probably have to redo the scenario. Right? It's going to, because it's something dangerous has been pointed out. And we need to stop it immediately, figure out what the red card's about, and then possibly either have to redo the scenario. We may be able to continue depending on what it is. But no, if you throw a red card, that's really serious. That stops it in its tracks. A yellow card's going to slow us down. We're going to discuss it. All right, so I'm gonna, if I catch something that's been skipped and I don't see some yellow cards up, I'll be like, hey, why are we throwing a yellow card up here? There should be a yellow card. Or if I see something, it should be, why is there not a red card up? Okay, it keeps everybody kind of involved. And so that's the plan for that. The other thing I want to do is this. When it comes to us doing scenarios, we got to step our game up on A's. All right, we're not E's, we're A's. You're in a position of leadership, which means you need to be very involved in this. Right, so we need to be on this mannequin. I don't want you to look at me anymore. and say, what's my blood pressure, right? I want you to actually take a blood pressure on the mannequin. I can put the blood pressure what it is. You're going to take the blood pressure. It's really no different, except you just have to use the blood pressure cuff that's on the mannequin. You have to, check it, right? You'll check it the same. All right. If you, don't look at me for breath sounds. Breath sounds be coming from the mannequin. That's what it's going to be. You will get very little information from me. Because this is how, if we practice this way, we'll play this way. I mean, in the field, you're not going to put the blood pressure cuff on the person's arm. Okay, that's right, that's good. And then look at whoever the paramedic is, hey, what's my pressure? Right? They're gonna be like, what are you doing? Well, this is how we did it in school, right? So you gotta have to touch them, touch the mannequin, and feel the mannequin, get your blood pressure on the mannequin. We're good at manual. Yeah, you'll do it manual. All right, so I think that was my idea for this. To try to step our game up a little bit and try to be more into this, more into the scenario thing. So what do y'all think about that?
I like that.
I do too. I think it's gonna work out. All right, so I think I am going to throw the PowerPoint up just for this patient assessment thing because we're going to have a test on it. But really, we know that patient assessment, really, even in this chapter, it's about these sheets. This PowerPoint is going to, when we go to it, it's going to eventually get. It's probably going to start exactly where that check sheet starts. So let's go to it real quick. Hang on 1 second before I do that.
Yeah, to sleep by 8:30.
I had already done that. Hang on, okay. Okay, so you stayed up and trying to do that? Did it happen? So you stayed up late for nothing? Yep. Oh, that's what you're joking. I mean, you tell me that's just rude. I let her know that my son has this one.
All right, so let's just look real quick. Well, here's just like on the sheet, the scene size up, our primary assessment, history taking, secondary reassessment, right? And look at your sheet. These are a little different than your sheet. What's the critical criteria? There's only two. There's only two, right? So National Registry redid these sheets just to let us know that in 2023, there'll no longer be a psychomotor test. Yes, in 2023, there'll no longer be a psychomotor exam. Well, there may be a psychomotor exam from the state office VMS, right? But if the state elects to do away with it, then they could. But National Registry is no longer going to require to show competency for psychomotor exam. Now they're going to add to the adaptive part. They're going to add some more, critical thinking questions to that, right? But it'll be up to the instructor to make sure that you guys are competent in this stuff like that. But anyway, So there's only two criteria here that you could do. And which are you order a harmful intervention or you exhibit unprofessional behavior. All right, so let's remember, what is a sign? What?
Coughing.
Okay. So it's something that a sign's subjective, just like when you're writing a PCR. Subjective, objective, right? So yeah, something you could see, right? You could observe it. Well, what a symptom? What is a symptom?
Somebody said my stomach hurts.
My stomach hurts. It's subjective, right? My leg hurts. My stomach hurts. Whatever, right? But then there's a chief complaint. How is that different than a symptom? It's really not, but it kind of is. So the difference here, maybe in a chief complaint, I call 911, you come out. Hi, I'm Mike, I'm a paramedic from the fire department, or I'm AEMT with the fire department. What's going on today, sir? Oh my God, it's about you here for the last 3 months. Okay, the last 3 months, my left leg has been killing me. And like 2 weeks ago, I went to the doctor, to get it checked out. What do you want to know?
Why'd you call me now?
Now, because my chest hurts, right? Okay, well, let's get into that. Right, let's get into the chest pain that you're having. That probably has nothing to do with your left leg hurting, right? Or it could, but maybe not. We need the chief complaint. What is the chief complaint? Why did you call us out today? What changed? Been hurting for 6 months. What changed in the last few minutes, last couple hours that prompted you to call us? That's what we eventually have to get to. So sign is something that's objective. A symptom is something subjective. All right, so we kind of talked about this on my last time here. We talked about critical thinking skills, how we get information, how we take that information and evaluate it, right? And then what are we going to do with it once we get it? How are we going to organize that information? And so when does this patient assessment form, when does any type of patient assessment, regardless if it's a form or in real life, when does it start? Does it start when you first get on the scene? It starts when you get the call. You start gathering and collecting information, right? So some stuff that you can get on that, right? Okay, this is an address. Okay, have we been there before? Right? Well, if I can look at, I can get some of that information. Whatever. Yeah, we were there 6 months ago. Right? For difficulty in breathing call. Well, this is another difficulty in breathing call. Okay. Well, I may think, well, okay, this patient may have a recurrent disease pattern. It could be, could be something to it. Right? Age of the patient. Right? If I'm going to a 23-year-old with difficulty in breathing versus a 50-year-old with difficulty in breathing, I'm thinking different. Okay, and I could be wrong, but it kind of starts setting my mindset a little bit. A 23-year-old, I'm thinking maybe asthma, still serious, right? Could be a serious deal. 50-year-old, I'm thinking, well, there's a couple different things it could be. It could be asthma or it could be potential heart failure, right? Because we get into that cardiac age group. So, kind of start setting the tone for me. I can start reading some comments about the call. Patient's been sick for the last 3 days. Okay, well, we know that congestive heart failure kind of works that way. We know asthma is more of a sudden onset. It just starts kind of getting your brain together. Start kind of getting your focus. Yeah, and some of that may not happen when you get there. You may have to change gears, but it starts getting you focused. We know about scene safety, right? And so, it's one of the first things that we're going to do, right? PPE and then what? Scene safety. Absolutely. And PPE is really about safety. It's about your safety, right? We don't want to get sick. We don't want to catch something we could have prevented. I put on some gloves. So safety, and we know some other safety things too. We know to look if it's a car accident. What are we thinking there for safety? Traffic. Okay, traffic. Something flew off the car.
Cut the battery.
Cut the battery. Absolutely, cut the battery. Make a record driver's day. Cut the battery. Right. Power lines, fuel on the ground, this sort of thing. Right. So we know that there's potential hazards there. We also know that it doesn't limit those hazards just to NPCs. You know, we're in people's houses, right? When I was at this conference, one of the medical directors for the incident that occurred a few weeks ago, I want to say Texas, where the guy decided to catch his house on fire. Tucson, right? Catches his house on fire, drives away from the scene of the call, runs up on some EMS units that were staging in the area of the fire. That was kind of their thing. That the AMR there was a BLS provider to the fire department, which was an ALS service. So they could call AMR for the BLS patients and stuff like that. But so they were staged in that area in case, you know, they were needed on that scene. The guy saw the ambulance there. He went up and started shooting at the ambulance folks. Shot one of the guys in the head. I think he just died yesterday. Shot another one, female. She was shot several times, chest. And she was able to call in a description of the person. The guy drives back to the scene. Now the fire department's on the scene trying to put the fire out. Shoots a firefighter. Fire officer was a captain, I believe. Right. Then saw the neighbor coming across the street, stops, shoots his neighbor, gets back in his car, right? Drives away from the scene, sees a police officer, decides to hit the police officer with his car, like hit the police officer in his patrol car. Police officer still doesn't know this information, right? So there's no lookout, there's no bolo yet, nothing. And the next thing you know, the guy gets out of his car, starts shooting at the police officer in the car. He was able to get his wits together and fire upon that guy and put him down. I don't think he killed him. I think he's still in the hospital, critical maybe. He died, maybe he died on it. But look, that's our, and I know that's very kind of like uncommon, but kind of not uncommon. That same kind of deal happened a few years prior to that. I think it was in Hawaii, I believe, of all places where that happened. It wasn't too long ago that Gwinnett County Fire Department was held hostage in a house. And yeah, wasn't that long ago that one of our ambulances got stolen and the crew was in the back working on the patient when it happened. Yeah. So it is not, so when we say safety, we mean it. You have to be observant to what you're walking into. Right? You have to be observant of what you're walking into. Not only do you got to think about the patient care aspect, but when you walk in, you really need to be thinking about if things go bad, even though they probably won't. But if they do, what is my means of egress? What is my way out of here? And if you find yourself without a second exit, position yourself to where you have access, if you can, to a second exit. Right? So like the door, I got a door right here and a door back there. If I can, I want to reposition to where that I can have access to both of these doors. At least I'm closer to an exit, right? And don't limit yourself to doors. What about windows? Right? Can I go out a window? How high am I? Right? Because you can't go out windows. I've done it before when the thing became unsafe. So it's a definitely doable thing. So I know seeing safety, so it kind of goes with PPE. You feel like, oh my God, I'm going to vomit. But there is a reason why it's said over and over again. All right, so we've talked about this in trauma, right? You get on the scene now, PPE seems safe. It's time to do what? So determine the mechanism of injury and the nature of illness. Oh my God. But it really kind of matters, right? It matters because a lot of these patients won't appear to be injured. And guess what? Science is not perfect. They may not be injured. But then again, there's going to be some that's going to be standing there that are going to be moderately to critically injured, and you're looking at them. They don't look like it. So don't be fooled. You have to start adding things up. Like I've always told you guys, the mechanism by itself, it's just that. But mechanism plus a weak radial pulse or absent radial pulse is something. That should start getting your attention. That should start getting your attention. Bruising. Do you think, is this an issue right here?
Yes.
It is an issue, but it may not, it may just be that and nothing else. But if we listen to lung sounds and we can't hear something on that right side, then it's something. A lot of guys, when you get new starting out, you'll be listening for lung sounds and you can't hear them. And so you're afraid to say, well, I can't hear them because they're going to think I'm stupid or whatever. They're going to listen and go, no, they're there. You just didn't hear it. Whatever, right? Don't worry about it. It's either you hear it or you don't. It takes a little while to get used to it, to listening to lung sounds. So you either hear them or you don't. It's okay if you don't hear them. Report that. Right? Report that. I mean, times if I had to go into a ER and said, look, you know what, they're probably there, but I just could not hear lung sounds on the right side. And one day it paid off. One day I said, look, I just can't hear lung sounds on the right side. Mechanism was moderate. Right, good. There was good chest rise and fall. I just can't hear lung sounds on the right side. Physician listened, immediately did a chest x-ray and pneumothorax on the right side. And about a couple minutes later, put in chest. But if I had to just threw that out there and said, look, I can't hear this, then it would have been, it's going to be extra minutes before the physician does his assessment or her assessment and finds that. Immediately after I told the physician that, the first thing he did was he went and he listened right away, and said, I can't hear me. Let me get a stat portable chest x-ray. And he continued with his assessment. They snapped the picture real quick. He looked immediately, didn't have to wait for it to be developed. Look right on the machine now. Yeah. What about penetrating trauma? We're sizing this up. So what do we need to kind of look for when we have a penetrating traumatic injury? Blood loss. Okay, what else? All right. So how do you know if it's still in there or not? What's that? Okay, well, yeah, maybe. What about like a bullet?
An
exit wound. If I'm shot right here, and maybe the entrance wound might be small, maybe it's even large, right? And you don't see any bleeding here. Is there a chance that blood pooling behind my back? Yeah, from an exit wound, absolutely is. So it's just something that we got to look at. All right, what about this whole thing called nature of illness? What about it? It is, right? We need to determine the difference, right? But is it possible that a traumatic injury can lead to a medical injury? Is it possible that a medical injury can lead to a traumatic injury? All the time. All the time. All the time. So you can kind of look at your mechanism. This vehicle looked like it came to rest against a tree. It doesn't look like it drilled it. It looks like it just kind of come off the road and glided kind of really softly into this tree, but my patient's unconscious. Things aren't adding up, right? Check a blood sugar, you find out your patient has, a blood sugar of 20. Oh, okay. You got a diabetic emergency at Legends. Yep. Keep it in there. And so we've talked about, we know what standard precautions are, right? Part of that EMT test, right? Standard precautions, are they different from somebody who's bleeding versus somebody who may have TB?
Yes.
Yeah, right. A mask then is a standard. It's at that standard level. How close are we?
About 20 minutes.
All right. Hang in there with me. You all right?
Yeah.
All right. So yeah. All right. So we're to determine the number of patients. All right. So we're still under scene size up, right? And so how many of you guys saw our question on your registry where it says you arrive on the scene of a motor vehicle collision, you're dealing with one patient who's unconscious, and a bystander reports to you, there's another patient over here, what do you do? Yeah, some of y'all did, right? Valid question, very valid question, right? You worked in a motor vehicle accident, you get there, you're first on scene, couple of cars, and somebody comes running up there to you and says, hey, there's a person down here that look like they're in the woods. Okay, well, your patient right here is kind of moderately injured. So we could separate, me and you are working together, say, hey, go check that guy out. But we got to start thinking, are we going to need more resources? Absolutely. So number of patients means a lot. That means we need more resources. And this section right here, scene size up, that's where that comes in. Radio, start being not only do we need transport units, we need hands-on patients, right? So radio, go ahead and start me another engine. Go ahead and start me 2 more transport units, right? I need some hands on the patients. I need some help triaging, right? I need some more providers here assessing these patients, right? Because realistically, we should only really handle one critical patient, right? One critical patient. You can take a non-critical too, but you're going to need to have somebody else taking care of the non-critical while you take care of the critical, right? So that means that, somebody from the fire department on an engine or something will ride in with AMR to help them out. All right, so other things to think about here, not just another engine, maybe we need another couple PD units. Radio, we'll go ahead and close La Vista Road at 285, have PD shut down La Vista at 285, and, start making a couple additional PD units for that. Right, that lets PD know, okay, well, they're working a major incident, so let's send some units to close the road. Also, something to think about, Captain Augustine, you all know Captain Augustine, the recruiter up there, probably talked to some of y'all. Most of y'all. So we worked together at the ER, and EMS had brought a patient to the parking lot to fly out. And so helicopter lands, and we're both working triage. And so me and him both were just staring out the window, and we were looking at this and thinking, I wonder what that guy, debating, kind of guessing a little bit. And sure enough, they roll out a patient who, looks like a pediatric patient who's alert, moving around, probably 5 or 6 years old, maybe, I don't know. But we were saying, dude, if we did that in a cab, we'd have to be writing letters, answering questions, and all this kind of stuff. Because here in the cab, most of the time we can get to a hospital within a reasonable amount of time. We don't always need an air ambulance here in the cab, but does that mean we don't use them? No. I've used them, he's used them plenty of times. Depending on traffic patterns, I-20, they're doing construction going west, and AXC and Grady are right down I-20 west. They're doing road construction there, it's been tied up, Am I gonna want to send an ambulance to try to maneuver through that and take 27 minutes to get to Grady? No. I'm in 17's immediate? No. Let me call a helicopter. They can come in. Because the patient be in hospital in about what, 7 minutes probably once they get in here. So no, so we still use it, but we use it when it's appropriate. And so that's something you need to consider. This is, you know, this is an appropriate use for an air ambulance, right? Something to think about. You think about it in this section. This is when you be putting those thoughts together. The goal in this, what's the goal of the primary survey? To identify life-threatening injuries, right? The goal here, identify and initiate treatment of immediate or imminent life threats. All right, so that looks like here, besides, request, we talked about consider stabilization of C-spine, and then bam, we're into the primary. And that is the goal of the primary assessment. We're going to correct anything that's life-threatening or could be imminently life-threatening to a patient. Thousands of examples of that, but the two big ones usually, what's one big one? You know you got to correct. Airway. Well, yeah, bleeding. You can say that first too, but yeah, either airway or bleeding. Right, so bleeding control. It doesn't matter where bleeding would come first. If you see an uncontrolled arterial bleed, stop the bleeding. First thing. All right, stop the bleeding. Second thing, if we had to put order in that, but realistically, we would do this at the same time. Right, we're not ever by ourselves. I'll be like, Parker, if you'll take care of that bleed, I'll open this airway. Boom, done. Right. And so, yeah, so that's, especially as part of an AEMT, that's how I kind of want y'all to think, even more training, right? You know, when you're asking about bleeding versus airway, you can ask airway versus bleeding. It's okay. It's okay to do that here, right? It's okay to say, hey, how's my airway? And by the way, is there any uncontrolled hemorrhage? So we're doing it at the same time. Okay, so that's the kind of thing we want to do. We want to, correct any of that stuff. All right, and so the general impression, and we've talked about this, right? But I really want to get it to y'all's head that as a student, you depend upon me to paint the picture of the general impression. But in the field, you depend on the patient to paint the picture of the general impression, right? And I was talking to one of my students that has been out there for a little while, and they said, hey, all that general impression thing the other day. They were like, hey, remember we were going over that? I finally get it. I can finally get to the point now where I can take a deep breath and actually just kind of look at them for a few seconds before I move on. I was like, yeah, I'm glad you got it. So that's huge. It's huge to be able, because you'll be able to start doing that and go, this one is extremely sick before they open their mouth. Not all of them, but most of them. Or you'll be able to say, I got some time, maybe this one won't be too sick as you're doing the interview process. This is your patient who's pale, cool, clammy, tripod position, just looks malice. Or the general impression could be uncontrolled bleeding, right? That's where you kind of depend on me as an instructor, but in the field, you'll be looking for that. You'll be looking for that kind of thing under the general impression. And then they talk about in this about the high index of suspicion of injury, but that's really under the mechanism of injury. And so, and before I go too much further, so you go all the way to the end of your patient. You go all the way to the end of your check sheet. You've got your vital signs. You formulated a treatment plan, and you've instituted that treatment plan. So what do you do after you do all of that? What do you have to do?
Check, reassess.
Reassess. reassess, right? And so you're going to reassess and you're going to start over with the general impression. Because if I'm giving my patient who's having an asthma attack albuterol and Atrovent, right? Albuterol Atrovent treatment. I've got an IV going. What do I need to know? I need to know if it's what? If it's working. So can I look at somebody and see by their appearance if it's working? I can. I can look at their general impression. Are they working to breathe? Are they still tripod? Are they still pale? Are they still flush? Are they still diaphoretic? Are they drying up a little bit? All of that kind of I can get from the general impression just from looking. So we always come back to the general impression. Always. So after we do that, right? So we've got the general impression. We need to know if they're responsive or not. So how we know the difference between responsive and unresponsive? Okay, let's see. How do we determine it? AFU. You can use AFU. So we can say A is for what? All right, B. Okay. E. All right. And then what would be U? This told me unresponsive, right? Right. So they're alert or not. So conscious and alert. Can I be conscious and confused? Yeah. So I would still be, I can be conscious and confused. Can I be conscious and slow to respond? I can. You can ask me a question that I should be able to answer right away. Sir, what's your name? Mike? So, all right. Something's up with that. That's not how a normal person should answer a question. Right? And okay, let me try, add a few more questions. If I keep doing that, something's wrong. Conscious, slow to respond. All right, so we got to figure out if they're conscious or not. And so let's say they're unconscious. What does that tell you to be suspicious of? First thing I want you to think of is airway. So even though if they're unconscious, that means I want you to start thinking airway till I can prove otherwise. Could be a strong possibility of an airway issue until I can prove otherwise. And that is the reason why that's next. You go straight to the airway. Right? But if I'm talking, then my airway's open and pain, obviously. But if I'm not, then we have to assume that there could be something wrong and we need to open that airway. Does that mean we're going to be able to put an oral airway in? No, it doesn't. But we can open an airway. You open my airway, there's a couple of things are going to happen. Either maybe I start breathing better, maybe I start mumbling, whatever, right? Maybe nothing changes. But open the airway. Open it. That's step number one. Right? We have a whole host of things to do afterwards to maintain the airway. But opening the airway is the very first thing. That's what's on. Y'all okay? Y'all still with me? We got about 8 minutes. Can y'all make it?
Yes.
All right. All right. So what is some of the things that when we're talking about the airway, what is something that will occlude the airway in an unconscious patient? Tongue could be like of course, there could be other stuff. What else? Vomit, blood, teeth, yeah. Debris, anything, right? All right, and then if it's a trauma patient, until chin lift?
No, not the.
Oh man. Yeah, modified jaw approach if it's a trauma patient, right? And so here we go now is So you've opened the airway. It appears to be clear. We're not out of the woods yet, are we? I can open a different airway all day long. And still I'm not doing any good. Right? I need to go to the next step. Right? I need to go to the B. And so what we have to do now is determine adequate versus inadequate. So what's an example then? How do you determine that? I mean, right, that's my number one thing, chest rise or fall. Right? Skin color, I like it. So speaking of skin color, what would be something that would be a sign of I've been having trouble breathing for a long time? Cyanotic. Right, good. Cyanosis. Right? Abnormal sounds. So what's an abnormal sound that would affect my breathing? Yeah, I like stridor. I do, because that's an upper airway type issue, right? Right. Bronchirales is something else too that could cause that. Whistling noise, you know, any of that kind of stuff like that. Down here it says, is the patient moving air in and out of the lungs? Well, we know that about chest rise and fall, don't we? Everything goes back to chest rise and fall. Always. All right, so we're going to do that, a rapid assessment, right, to determine that. It'll take me a couple seconds to determine that. I'm looking at somebody's chest. If it's not rising and falling, then we got a problem, and I need to correct that. But what if it's also, what if it rises and falls and it doesn't do it again for 25 seconds? That's a problem, right? I had good chest rise and fall for a second. But also fast too could be a problem. Too slow could be a problem. Too fast could be a problem. Right? It's just like the heart. You know, too fast, the ventricles don't have time to fill. Too slow, we're not circulating the blood. Same thing for the respiratory rate, right? If it's too slow, well, the lungs they can't refill again quick enough to circulate oxygen, right? But if it's going too fast, what can the lungs not do? They can't inflate all the way. They can't, right, you don't get gas exchange. And so then we can look at the effort, right? We can look at the effort of the person who's breathing. This is someone who's showing a great deal of effort. They're in a tripod position. Their respiratory rate is either extremely fast or extremely shallow, right? There's a lot of effort going on here to breathe. We're just not getting a lot of results. So again, tripod position would cover a position like that, right? You know, is this somebody who's concentrating on breathing? And what they mean by that is they're sitting here, they're in this tripod position like this, and they're just staring straight ahead. And you're like, sir, my name's Mike, paramedic with fire department. They're not looking at you. They didn't hear you. They're trying to stay alive, right? They are in the maximal position that they can do to breathe. They're not going to move. They're locked in. This is it for them. They're dying. And this is all they got left. And so that is a bad place to be when you're concentrating like that on breathing. So we've talked about tripod. And so what's a sniffing position? Yep. And who do you see sniffing positions? You know, a lot of kids. Those kids are ones that are really big nasal breathers, breathe through their nose a lot. All right, so we've covered A, we've covered B. All right, and so now we're going to C. C, Charlie. All right, so now we need to evaluate the circulatory system. We need to evaluate how well is blood going through the heart, or coming from the heart, rather, right? And so if you looked at a VQ ratio, we talked about the V part. Now we're going to talk about the Q part. We're going to talk about the blood part. Because we can be breathing fine all day long.
But if something is wrong with the circulatory system, and we can't get red blood cells back over here to the capillaries of the pulmonary, and we can't have gas exchange, it doesn't matter how well you breathe. People die every day like that. They were breathing just fine before they bled out. Right? So we need to evaluate that. And so here's pulse, and this is the definition of a pulse. It's that surge of blood through the arteries that you palpate, right? I mean, at the end of the day, that's what you're looking for. So this is a radial pulse, carotid pulse. You already know that. Here's a kid checking in the brachial, right? You remember that? You got a kid, that's where we need to check it, the brachial pulse. All right, so we have a pulse, and maybe we have a weak pulse, and we have a strong pulse. It could be whatever, but we need to look at anytime I had somebody with a weak pulse, and that was always my thing. I did the 2 a.m. I may not listen to a word you're saying, but I checked for a pulse. And when I didn't feel if I didn't feel a pulse in the radial, I started kind of waking up a little bit. And the next thing I'm looking for is that skin color and tint. Are they diaphoretic? Are they cool? Or, moist? What's going on here? Right? Because what does that let me know? What's happening in the physiological stage here if the pulse is weak to absent and they're diaphoretic? Good, right. And you said it. What if anybody else? I mean, yeah, we're looking at shock, but what's happening during shock? Physiological. Vaso what? Vasoconstriction. Or perfusion, hypoperfusion, vasoconstriction, release of what? Epi and norepi release, stimulating sweat glands, right? So something's up. Something's going on now. I'm going to listen to you. I'm sorry. What did you call this for today? Let me zone back in here. Right? I need to find out now because something's up. Right? So we learned that from being objective. Looking at that skin color tint.
About 45.
All right. All right, so we'll stop here. We'll come back. I just all we're doing is just doing a quick refresher of the checkoff sheet, right? If you know this very well, we'll do fine on the exam, right? All right, good. So take 15 minutes. You gotta go see your favorite person.
For what?
6 7.
Are you?
No. That's a lot.
Yesterday's up there?
Yeah.
Never signed Grim.
Kirshner and Willis. Make sure you sign in. What?
Grim never signed in yesterday. He was here.
Griff. Yeah.
Six.
I told myself on
What?
Time I gotta be back.
Ever?
I be one of these. Yeah, I know Balloon, JJ, I think so. My man, like on the outside of my hand, but it ain't like it's like, but it ain't like it ain't that crazy like it should. If I had the radio still, it's not tight. I just think that's why. If you wait. That's crazy.
And it's big, this is the one. Nothing's big.
Stop. Stop.
I didn't say anything. Jimmy is the biggest thing I've ever seen before.
No, nothing is big. It's like.
I didn't say anything.
That shit you said about Jones.
What is a joke?
Listen, no, it was funny. It was super funny. That's why it was so funny. I was like, no way he said this.
Hey, how much sugar is in that?
40 grams.
For two?
He had a little styrofoam cup the other day. Poured a whole thing into it and dumped a little bit of water to it and drank it.
Hey, Abigail Toad.
I got control like a 2 mile radius. Right.
Like, when it comes to public schools, police.
Easy with the same.
Excuse me, sir.
What's your problem back there today?
You thought I was like antsy or something? I was like, no, it's just me. That's good, just sound like that. Need some fucking water?
Oh, okay.
You got a problem?
No, man, I'm straight, dog.
You got a problem?
Oh, big buddy, I'm good.
Look at that. All those.
Look at all those chickens.
You're welcome. You can get some. Whoa.
That's your fault. My fault. I didn't do anything.
Hey. Blueberry.
Hey, man, you're still here.
Yeah, that's just something.
Had to change my snacks up, man. Something with calories, man.
Oh, really?
You got one of those, detachable shower heads? You know what I'm talking about? With the hose on? Yours is just affixed to the wall? Oh, that's tough.
I got.
Huh? Yeah. Well, I mean, it's not used neither. That's how you get all that sand out between the lips. You know,
Great, man.
you got the one leg up on the side, you know what I'm talking about? Just how your mom used to use that Dollar General do.
Make sure you get a soft.
I think you gotta go hard left field with them. boy.
$2,000 one-time.
Huh?
We have a new assignment on Target Solutions called one-time $2,000 incentive bonus.
Usually it's
$3,000?
Yeah. That's something different. Well, that's it up, huh? Oh, you ain't got it in mind?
They should make me sign for it.
Huh?
They make me sign paperwork for it.
What?
Oh.
That's awesome.
I'm not signing for 3 days after I get it.
What's our email address?
You ain't signed it? You didn't know I want to do it? Smart. Because if they don't follow up, it's on them. I wish you would overdraw my account.
I think tell somebody after they get paid.
It just said that in their little letter they have.
Oh, no, it's for people that didn't get $2,000 one.
What they get.
You guys know who got it.
That last over?
Hell yeah.
Victor was good today. Probably even better tomorrow. Terry, so what? Right. Hey, brother. Good to feel.
You know how to mile work.
Are you a fan of Kiwi? I think what happened over back in the day, I can't remember if it was public or private. My mom used to take, and they had this little punch card when we was kids. And once a week, grocery shopping with your parents, you could use that little punch card. And they had a fruit of the day, depending on what day it was. And you get a free piece of fruit. And it always seemed to be kiwi a lot. So I say a lot.
Like LBM.
Oh.
Sorry. Sorry about that. I got to do it.
You know what I mean? Tell you ain't in the dumpster, they out there taking a pack, boy, you're. Hey. Watermelon? Fuck with the watermelon. Fucking gotta put that mustard on there, boy. Dude, I won't eat it out. Dude, it's so good. It's so fucking. And then cinnamon on there is good too. On watermelon? Grill? I ain't hit it on the grill yet. I fucking cut it up, put that mustard on there. Hell yeah. Fire, dude. And that mustard's good for the cramps. You heard me? You get that water in, you get that mustard. Dude, you can eat watermelon for days, bro. With no calories. Huh?
A lot of it straight sugar.
No.
Go in the air
100
fryer.
grams is only 30 calories. It's hard.
Hard.
Fruit
Yeah.
juice is fruit sugar.
It was relating to something.
He was in pain, bro. He needs to. That's different than sandbagging, bro. That's a legit angle. I think our Jones shit. That's real shit. You know what I mean? When Jones is walking back and forth to his car just fine, and having the rest of his days fine, but he's sandbagging like fuck out there. Jones can barely fucking walk right now. That's real. You know what I mean? Just puts hurt all fucking day. I'm just when you run. They don't just start when you run. I used to get There's a lot of injuries that people don't realize the golden ticket. Price. So, I mean, it doesn't, you're not gonna fix it now.
That's what club over there. It's no range, it's clubs, like hotel, it's really on.
You might have to bust the toilet we got. Okay. Right, take 3 days off.
He's to have a big ass arm.
Otherwise, just drag it out. I was wondering, was that Kirsten? We talked about it. You gotta rest it though, otherwise you're just prolong. You know what I mean? You gotta know the difference in sandbag. You're hurting walking through your car. Jones only had 2 points there in the Allen. You see what I'm saying? And he was fine. You got real injury. You got arrested.
What's that little? The whole front of my car, you keep going down, foot down. Yeah, like.
It was sitting right here. So my wife, when she quit her job, before she quit, she told him, "Hey, I'm only quitting because I got kids. I'm driving hour and a half. I'm losing 50 hours a week in driving." If you let her work from home, I would leave.
All right, so if somebody has jaundice, right, liver action. So, all right, so y'all knew that, right? And you knew that because you probably memorized it, learned it for an exam, right? Yes. Some of you probably, yeah.
That's all bad.
All right, so when you're seeing stuff, I want you to start answering questions based on how you understand the physiology. I want you to see that. Right? I want you to see in your head when we say somebody's diaphoretic or the weak radial pulse, I want you to see those vessels constricted. Right? If you look at your arms and think about the arteries and veins becoming small. Right? When we think about a diabetic, I want you to look and think about the cell. I want you to think about the cell and the receptor that's sitting there waiting on the insulin to land in it, but the insulin's not there. Look at the glucose that can't cross over, it's just piling up. That's how we want to start looking at this stuff. All right. So skin temp, obviously. Right, depending, like if it's a medical call and it's really hot, what's that tell us? Fever. Right, fever, right? All right, what if it's an environmental emergency call? Somebody's been out jogging and, right, heat exhaustion, right? So may not be like super hot, warm and moist, right? Or the same call, heat exhaustion, but the skin's cool and moist or cool and dry. Still a problem, right? Because now they're no longer sweating. Big deal there. Big deal there. Now we're looking at somebody who's probably leaning towards more of a, what they call a heat stroke instead of heat exhaustion. CRT time. All right, what is going on there?
2 seconds or less.
2 seconds or less. Why are these CRTs, if they're delayed, what's happening? What's that? Okay, capillaries aren't getting oxygen, yes. Right, because why? Because blood's not there?
Not flowing properly.
If blood's not there, it's there, but it's very limited. Because, why? Because the vessels are constricted. The blood that was in my fingertips has been used somewhere else. That's why they're cool. The blood is warm, right? And that's why when you push down, it stays pale forever. All right, so we know too that any type of external bleeding, hopefully, and we've seen it in the general impression, but they like to put it here because C for circulation, right? Circulating, heart pumping blood, outside bleeding. So it just kind of lands there to get placed, but hopefully we caught anything severe in our general impression and we're able to stop it then. So we go through the A, airways open, patient stop breathing, and there's no pulse. Time for what? Right, for CPR. All right, what is a disability? We're assessing the patient for disability. What does that mean? Not really. What are we talking about? Yeah, that's what we're talking about. A disability would be, we're talking about LOC, the level of consciousness, right? So we're gonna perform a brief neurological exam. We want to know what that patient's mental status is. All right, so we already talked about this, spinal mobilization. We want to know that kind of thing before we go into the actual primary, because somebody's going to have to hold manual seat spine control. I just left that conference. It was represented by lots of people all over the nation. Some places aren't even doing long backboards anymore, right? Unless it's a major trauma or something big deal, so we'll see that one day where we don't use them as much as we're already using them.
Why?
Because what they found is that usually it takes quite a bit of mechanism to fracture a vertical, the vertical column. It takes a lot of energy to do that. And even then, patients don't always suffer a spinal cord injury. But what they're also finding is, through research, is the amount of turning that's happening while we're putting them on a backboard, and the actual backboard itself sometimes is causing more of a problem than if we just tried to keep the patient relatively still on the stretcher and transport it. So,
Makes sense.
yeah, it kind of does. That's the latest research anyway, showing that. So it may be a time where I know just for myself, any patients with gunshot wounds in the field, unless it was directly over the spine, I was over immobilization. So that took time. And I noticed that I had a lot bigger, I got patients in the hospital alive a whole lot better when I just said, let's load and go. I mean, literally, we tell who's ever working with me, just go sit in the driver's seat. We're going. As we were going to the truck, just go get in the driver's seat. As soon as the doors closed, bam, bam, we're gone. That worked. I mean, literally, when I took it serious about the on-scene time, it worked. But yeah, so it takes several minutes to mobilize these folks. That's something you got to think about. So, risk versus reward. We're going to risk a little to save a little. We're going to risk a lot to save a lot. You got somebody with 2 or 3 bullet holes in their abdomen. chances are really good you've got an organ that's bleeding. Right? Chances are really even better you don't have a spinal injury. I'd rather go on the risk of their bleeding to death than let's go. All right. But there are times when it's needed. Not very much, but occasionally. Right? Occasionally, there's major mechanisms. The person's like, my legs are tingling. Right? I can't feel my legs. Right? Stuff like that. We need to take that seriously. That patient needs to see calm. And as of today, we would back. We talked about APU, Glasgow Coma Scale. We struggled with this a little bit. We did. We'll get to that probably in the Euro chapter. It's not coming up here. Assess, again, we're assessing the disability. So you see, these are some ways you can do that. So if I did this, if I did C here, and I pinched right here around the neck, what is the response I should get from the patient? Okay, that verbally, but what about a physical response? Trying to he's not trying to knock my hand away. If I'm doing that on that side, let's say the right side, and the patient raises their left arm and sweeps that way, that would be a bad sign. That would let me know that what's going on. Yeah, neurological injury. I might have elevated what? Intracranial pressure. Right. That's the kind of stuff we're looking for here. So if this patient right here, C, they're pinching this the muscle here, I want to say the mastoid muscle. I don't think that's exactly right. But anyway, nonetheless, providing stimulus there. Right? And the normal response would be ouch, verbally, something like that, or to raise their right arm up and move my arm away. But if they raise their left arm up and start sweeping that way, that's going to let me know that there's probably a neurological injury. I probably have rising ICP. And why is that important for me to know that? Can I fix it?
No, you don't. Good to go.
Okay, transport. And where I'm going to transport to is going to matter. Am I going to go to a hospital that doesn't have neurological services? We'll go rolling into Rockdale with that? No. We need to go to Atlanta Medical Center, Grady, Trauma Center, that has those people standing by. That's why we need to do that test. Because what if we don't do that test? All right, well, there's 10 different things that could cause the patient to have altered mental status or to be unconscious. And I check their blood sugar or whatever. I'm doing that, or maybe I think they're diabetic. I don't know. And I just go rolling into Rockdale. We go to CT and find out that they have a bleed. We got a problem. Now we got to get them to a hospital where they can do this procedure to save them. And it's probably going to be too late, to be honest with you. It's going to take us an hour or two to get them out of the hospital. Yeah, because we have to get paid for it. I get accepting physician, right? And if I'm AEMT and I'm kind of full, I don't have to accept. If I'm Grady and I'm full, I don't have to accept. So we're calling Augusta, right? So these are the steps that we're doing. And then once we do, say we call Grady. Grady's like, yeah, we're good. And it's raining outside. So we can't fly them out. We call National. Hey, we need to get a transport unit of your emergency. Okay. There's going to be a couple hours still because we're busy running 911 calls and this, that, and the other. That's why it matters. That's why it matters where you take these folks. So, exposed. What are we talking about here? We talk about exposed. Huh? Clothing. If you can't see it, you can't fix it. Yeah. Seriously, I mean, we're medical professionals here, guys. Ladies, we got to cut the clothes off. We can't fix it if we can't see it. Right, so clothes have to come off with a major incident. Right, and I'm not saying, I just got rear-ended it. Right, and you're saying, Strut Morris, I'm sorry, but we told you. We ever caught you in NBC, we're cutting all your clothes off. Okay, that's what we're talking about. We're talking about something going on. Yeah. Socks too. We'll see what the feet. All right, so no, we're talking about somebody with moderate mechanism who has the altered spinal status. Yeah, we have got to get those guys ready so that we can identify injuries. Right? You guys know I'm not a big proponent of acronyms. You can tell me DCAT, BTLS all day. I want to see DCAT, BTLS going on. I want hands on the patient. I want you to, I'd rather say, we'll look for trauma. Because I know what your mindset is at that point. You're looking for trauma. You're not memorizing. You actually admit it. You're looking for trauma. All right, that's just me. All right, so sudden death. Right? So there's only a couple of calls this year. They're probably right. One of them, if you don't fix this up here, you're going to die quick. Upper airway obstruction. Right? And that could be something simple, just opening the airway. If the tongue's obstructing the airway, that's an easy fix that people die from all the time, even with competent medical providers such as physicians. When they go to, you know, we call it conscious sedation. You're gonna put something back in place, or maybe you go to have a procedure done at your dentist's office, or maybe you go to your cosmetic surgeon, right? And they say, look, we're going to give you some sedation. You're not going to feel a thing. And you don't. You wake up dead. All because your tongue relaxed at the back of your oral pharynx and you stop breathing and nobody noticed it. Because you're not going to struggle too much because you're sedated, right? So it's stuff there. I mean, it's a simple fix, and it's happened. There's been plenty of malpractice for that. Life-threatening bleeding would be another one called a quick sudden death, right? You know, you have an arterial bleed. You're going off like a sprinkler system. That's not going to stop if somebody puts direct pressure on it. That may not stop you putting American on it. So it's the stuff that's got to be done. So they talk about, all right, so to be able to work these things out, we want to do that rapid full body scan. And that's really important for the patient who's been involved in a traumatic event and they have an altered mental status, right? Because they can't tell you where they're hurting, where they feel like they're bleeding from, right? So those are the ones that we're going to do this rapid full body scan. And if we need to, we'll protect their spine. We talked about minimum times on the scene, talked about MOI. Now we're going to talk a little bit about history taking. So we're on that part. So now pretty much primary assessment's done. That if you're on a trauma, your rapid body scan is done. And if you're looking at the medical, primary is done, you're looking at history taking and secondary assessments. And so we want to gather as much information as possible. And trust me, it matters. It matters because I get a lot of patients in the hospital that are altered, and I don't have a lot of times I can look even at the outside pharmacy where they've got stuff filled. But sometimes if they're from a different state, they've only been here a few weeks, I don't have that. You had access to that, right? You saw medicine bottles, right? It was just something you saw. Take a minute to do one or two things. Either write them down, or if you need to go, pick them up and take them with you. Bring them to the hospital, right? Because if they're altered, I can look at a medicine bottle. What can I determine?
6 rats.
What's that?
The rights. Right there.
Well, yeah, but what information? So I can find out, I know their medicine they're taking, right? Could it cause this, right? Or they can tell me their medical history. You're taking high blood pressure medicine, I go, okay, well, this is lisinopril. They must have a history of hypertension. Oh, this is Coreg. So this is something to reduce cholesterol. They may have a history of cardiac disease. Okay, so they're taking this, that, and the other. I can start putting together some stuff, right? I can start looking at that kind of thing. So that's stuff too. And also, especially in a COVID world, a lot of times bystanders get left at the house. Right? The only people who are in the ER are the patient who's sick. There's no family, no bystanders. Right? So you have access to them. They tell you a lot. They tell you when it started, how it started, what they've been like the past couple of weeks, what they complained of when all of it went down. Right, it's a lot of information. And you can get their name and telephone number so we can call them. Right, I'll take as much information you got. You may have everything. And I don't have to call anybody. Or you may tell me everything and that day I'm super busy and I forgot one part of it. Right, I can gives me access to call somebody and say, hey, what's going on? So you want to always narrow it down. All right, what did you call us for today? And then start investigating that chief complaint. All right, so chest pain. What's important about chest pain? So there's two primary causes of it. What are they?
Prior history.
Huh?
Prior history.
Okay, so cardiac chest pain, and then there's another type of chest pain. Pulmonary or respiratory type chest pain, right? And so, all right, so that's good. So I like to start trying to figure out what am I dealing with? Because do 24-year-olds have heart attacks? Sometimes, rare, they do. 50-year-olds have them all the time. All right, but am I dealing with something here that's maybe a respiratory type chest pain or cardiac chest pain? So how can I know, how can I assess this chief complaint to figure that out? Okay, lung sounds. All right, what else? What's that? Pulse ox. Pulse ox up here. I mean, you can look at the pulse ox to determine if it's respiratory or not sometimes to go with that. Give me that. What's that? Okay, you can do vitals, but that's not going to tell you if it's not going to lead you towards if I'm dealing with somebody with a cardiac problem, an MI, or am I having this chest pain from a respiratory issue? So, okay, you can look at some edema, maybe. Okay, it's something a little easier than that, though. What's going on? What? All right, hang on. Let's back up. Let's look at the pain. So, what is a sign of a person having a heart attack? How do they? It's not a female. Say it's a male. How do they describe their pain? Crushing, sharp. And where does it go? Might radiate to the left arm, right? Okay, well, there's something that, kind of a guy thing. Can't always apply to females because they have what we call a specific without specific complaints. Okay, so we can look at that. What else is about this pain with cardiac chest pain? Can you change it?
What were you doing when you?
What were you doing when it happened? Right?
What makes it go away?
What makes it go away or does it, right? And I go, well, nothing really makes it go away. Okay, well, that's leading me down cardiac road. Well, what if I say, well, sir, raise your arms up in the air? If I raise my arms up in the air, go, oh, yeah, it's much worse when I do that. Is that leading you down towards a cardiac type chest pain, or maybe is that something else? Could that be a muscular type pain? It could be, right? Because if it gets worse when you raise your arms up in the air, right, then we can reproduce that pain and it becomes even more severe. So What if I say, well, sir, man, take a deep breath for me. Does it hurt worse when you take a deep breath? And they go, oh yeah, that's much worse when I take a deep breath. Well, so we've reproduced that, right? We've been able to say, okay, well, this pain's reproducible. I'm not saying it's not an MI. I'm just saying that I feel a whole lot more comfortable and leaning towards something like muscular or respiratory being the problem than it is cardiac. Right? That kind of helps me to go down the right road. That's what we're talking about. Investigate your chief complaint. Investigate it. Look into it. Yep.
So that pain going down that long, that's still leaves.
Nope, that does not lead to respiratory. Usually, generally male patients who complain of chest pain, substernal, that radiates into the left arm, that is a classic type presentation or description of an MI. Right? Or sometimes they'll say it radiates into my back or into my face and jaw. Right? That's more of a cardiac description. If you ask, say you ask me, sir, you're having chest pain, I am. Does it radiate anywhere? No, it just stays right here. Okay. Start investigating from that point. Okay, so does anything make your pain better or worse? Yeah, if I can get up and move around, it hurts a lot worse. Okay, well, when we move, we use muscles. All right. Raise my arms up. Hurts worse. Oh, yeah, much worse. Okay, muscular again. What? Somebody said over here, what were you doing right before this happened? Well, I was helping my friend move. Oh, okay. So you've been lifting some heavy stuff today, right? Good pulling a muscle in your chest. I'm not saying, sir, you just got to pull a muscle in your chest. Go take some ibuprofen. We'll see you next week. Maybe not, but you know, no. I'm not saying that. I'm saying let's investigate the chief complaint. Let's try to determine what we have, right? Because ultimately, I'm trying to predict here, try to diagnose a heart attack between your full muscles, not to leave them on the scene, but how am I going to present this patient to the emergency department? If I present this patient to the emergency department, how many times do you think you can present that type of patient to the emergency department with those complaints? And you clearly now start to understand that's muscular, and you present that as a cardiac, and I go, well, here comes Campbell again with another person with chest pain. You know it's bullshit. Everybody he brings in here, he thinks I have a heart attack. All right, room 33. All right, I'm putting it way at the end. But if you can present this patient, hey, it's a male patient, cardiac age, but his chest pain's reproducible, upon palpation, upon movement, upon deep inspiratory breaths, stable vital signs. I go, okay, cool. Yeah, you're good. Go to room 20. Comes in the next week, you got 50-year-old male, chest pain, substernal radiation to the left arm, pain scale 1 to 10, rates it as an 8. Associated symptoms are nausea, he's vomited twice, and he's diaphoretic. Gotcha, man. Room 3. Room 3 on arrival. Right? Because he's got something. This is sounding very cardiac. This is sounding very cardiac. So that's what we're trying to do by investigating a chief complaint. We're trying to investigate it, come up with a conclusion so that we can paint the appropriate picture. We get that by OP QRST. Do we need to cover that? I would hope not. What about sample? Do we need to talk about that? Nope, don't get with sample. Should be. So we're talking about vital signs here. Obviously, we want the respiration, we want the pulse, the blood pressure, LOC, all that, right? But let's say you're on fire truck, you're on war wagon, you're down there off Glenwood, got a patient have chest pain, he's 48-year-old male, diaphoretic, left arm, pain scale of 8, nauseous, right? And we get these vital signs, you know, we check the blood pressure, pulse, respiratory rate, pulse ox. We did a blood sugar. The ambulance, they're mad. meaning no available transports and they haven't even dispatched it yet. It's standing by to be dispatched. You've been there 9 minutes. All right, so what else can we do? What else can we do to start besides, I'm not talking about treatment. What else can we do as an objective tool to try to see if we're dealing with somebody who's having an MI or not? An EKG. Right? This is when you can go ahead, look them up, do a 12-lead EKG. Right? It doesn't take a rocket scientist. Y'all figured that out the other day. It's about placement. It might take a rocket scientist to figure them out sometimes. I'm not asking you to diagnose it. Put it on. Right? At 12 lead. It will interpret it for you. It'll say star, 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 AEMI or something, STEMI, STEMI, star, star, star. And you'll go, okay, well, we got a STEMI patient. Right? You're all going to be AEMTs. This would be a patient I would start a couple IVs on, not just one, but two. Right? I want 2 IVs because when they get to the hospital, we're going to have multiple medications going in. Right? I want multiple accesses for that. I want, when I get there, I'd love to have a good line to draw labs from. Right off the bat. What kind of lab would you want to do?
For AMI, we're
Yeah.
doing cardiac, all the cardiac.
No, you're right. Is there one special enzyme you want to run? Troponin. Let's run a troponin. Here's a troponin real quick. Troponin's an enzyme that's not found to be 0 unless you're having an MI. If you're having an MI, it's going to be elevated. Anything above 0 is elevated. Well, 0.45, I think is elevated. All right, so that's what we're talking about. So get us a couple of lines, a couple IVs. You can do that while transport's in around, right? You know your patient's having a STEMI. Couple of things that you could do too. Radio be advised, I got 48. Radio just be advised, I have a 48-year-old male suffering a STEMI. Please prioritize that unit, whatever. You know, because if I'm sitting there holding 8 calls for AMR to dispatch, 6 of them are all BS. Right, and y'all were 7th in line to get an ambulance. And these dispatchers are just that. God bless them, but they're dispatchers. All right. I mean, God bless them, right? I'm seriously. Some are better than others, but seriously, they're looking at the time that you've been there. They're trying to get you an ambulance as quick as they can. They're stressed out. If you say, hey, my patient's suffering a MI radio, so we need that first available unit. 10-4 radio is clear. If I'm dispatching, I'm going to make sure that you're getting the first one that pops up. Right? So that's all that stuff you can add to that. Radio's clear. Be advised, we'll dispatch the first available unit when it comes down. Something like that. God, I hate that guy out there. Who is that asshole when he gets that? Wow.
Yeah.
But you know,
Just so you ain't the one piping down. Somebody on the other end of the radio is. Just say, oh, hey, man, the ambulance.
so entitled CO2. Get ready. We're using that on every patient we deal with. Because we should be. Right? We put a nasal cannula on. It's gonna tell us entitled CO2. What is the number of entitled CO2? And why you don't know about CO2 now. CO2, if it climbs up higher, what's it gonna cause? Oh, everybody, man. Say it. Acid. Acid. Right? And acid's only good if you're tripping on it. I didn't know where you were going. It's always done. It's never good. It's not good in a metabolic state. Right? So we need to know these things.
See that shit coming.
We need to know these.
That's my man.
So we'll be using it. All right, so here's your monitor, right? You plug in your entitle right there. We're going to get a blood glucose.
Oh, we can do that.
All right, so when we're doing the respiratory system, we need to listen to lung sounds, right? That's gonna tell us a lot. So we already know that. I don't want to cover that again. We already know we're looking for a certain rhythm. We're looking for, 12 to 20 breaths per minute. So here we are, auscultating breath sounds, right? Do you notice that their stethoscope is against skin? That's the only way you're gonna hear breath sounds. You're not gonna hear them through their clothes. They need to unbutton their shirt so that you can put your stethoscope bell on their chest to be able to hear breath sounds. All right, we know about the cardiovascular system now, a lot more than we did. We know what a pulse rate is. We know what it means. We know where to find the pulse rate, right? We know if somebody's heart rate is 150 beats per minute or greater, if that's a problem, right? We even know cellular what's going on. Who can tell me, just curious, at the cellular level, what is going on if my heart rate's 150? What's happening? What I might have too much of? No, something else. Sodium. Right, because sodium is the primary one that brings action. And when sodium comes, that's the action, right? And so the action potential comes when what? When the school bus driver gets there, comes in a form of an action potential. What's he coming there to do? He's coming there to tell sodium to go inside the cell, and he's telling potassium to come out. And calcium is holding the door for sodium, right? It gets stuck holding the door so potassium can come in too. And once everybody's inside, what does calcium do? It joins sodium and waits for them to move. And so that is a resting potential. So we know that, okay, if I have a heart rate of 168, that there's a good chance that I got too much sodium, right, outside that cell. There's a problem maybe that sodium can't get back inside the cell, right? So there might be a problem with calcium holding the door, right? And so, or there might be a problem with potassium coming out. So, but we can bet the action potential happens when sodium is where it's supposed to be, potassium is where it's supposed to be, right? So if I have a slow heart rate, then I have a slow heart rate, what is happening at the cellular level?
Not enough.
Sodium then, maybe they're stuck inside. And maybe potassium stuck outside. Maybe calcium's not opening the door, maybe not. But something like that could be happening. Well, remember, a cell has it's a part of your body that causes things to get done, right? Cellular processes throughout, hormones to be secreted to help you to produce, antidiuretic hormone. The cell does all that kind of stuff, and it controls all the processes in the body. And so, why is this important? Well, it's important so you can see that in your head, so that you can start investigating other things, medications out all kinds of places, right? Calcium channel blockers, there's sodium blockers, there's beta blockers, all the stuff that's out there. It helps you to kind of to see it, so you can, if you can fix it, you can fix it. You need this knowledge so when you progress on to paramedic school, you'll be ahead, you'll be ready. That's what AEMT is. It's taught, just make sure you're going to paramedic school. So that's what's going on physiologically. Too much sodium, not enough sodium. Too much potassium, not enough potassium. Or what did we say calcium does? What does calcium do? What's its primary goal? It does open the door, but what does it do? What's its objective? Besides,
Follow sodium.
I'm sorry, I'm trying to say, what's his primary duty? Not hold the door, not open the door. What's it do to muscles?
Right.
Yeah, so that's what calcium does. Calcium causes muscle contraction. And so what kind of muscles do you have? You have smooth muscle. What other kind of muscle?
Cardiac.
Cardiac muscle, right? And then, right, voluntary skeletal muscles. And so, did you know that when you take muscle relaxers, Valium, that it's actually a calcium channel? It messes with the calcium, basically. It's gonna mess with your calcium. That's how it goes. What's it gonna do? It's gonna reduce the ability for calcium to cause muscle contraction. By either not coming back in to hold the door sometimes, or to do what it does. It is, but it's also a major muscle relaxer. Right? Because what's happening with your season? Exactly. See,
Like I knew that.
right? So I think you're fine. Right, but so those are medications then you can look at. Right, and when we get later, I was going to talk about magnesium being the Debbie Downer of the cell. Debbie Downer. And they try to keep her out of the cell because she's so negative. She always finds a way to get in, and when she does, and she hangs out inside, she causes negativity in there. That causes a host problem. But look, I just want y'all to think about physiology. You got to. It's hard sometimes, but if I can ever get you to thinking like that, there isn't anything national history can throw at you, they'll stop you. Because you'll know it all. So we've talked about blood pressure. Everybody feels comfortable understanding intracellular fluid, extracellular fluid. Okay. All right. We know how that works. There is a video we're going to watch when we get over there to neuro a baby sooner or later. This guy does a really good job of doing a neuro assessment. We know about these. There's no way I can keep going. We're not going to talk about any of this stuff. We talked about reassessment, and the biggest thing I just want you all to understand reassessment is go back to your general impression, please. Go back to your general impression. Everything starts there. And when you're doing your assessment, for God's sakes, learn this. Learn that get your vital signs first before you come up with a treatment plan. That way you don't get in a situation where you're going to give nitro to somebody with blood pressure 80/40. Right? And yeah, so I don't want y'all to do it if you can help it. This is not good habits. All right. That wasn't too bad. It was good routine, right? I mean, it was. I think we needed it. I do. I think we needed it. It has been a while. It has been a while. So what I want you guys to do at this point. All right. So what about the check sheet? So this is what I want done. I'm going to get you guys a folder, right? And I want everybody in your squad. I want somebody in your squad to check you off that you can do this. That you're confident, right? So everybody, I don't care who it is, Jenkins. If I'm in Jenkins squad, I can say Jenkins. I'll do this patient assessment. Here's a sheet. Check me off. Make sure I'm good. If they miss, mark it. All right. I want to know. I want to know. Then if I miss it and you go, Mike, and do me a favor. I mean, because you're only doing your fellow firefighter recruit brother or sister a favor by doing that. And you go, Mike, you did really good
but you really didn't verbalize that treatment plan for the patient called for appropriate interventions. I didn't think it was appropriate, call for nitro, blood pressure medication. So I got you, I made an X there. And I go, okay, no problem. You get you another sheet of paper, another assessment, and you check, Jenkins, I'm ready now. And you go do it and you check off and you're good. When you have that done, I'm gonna check you and we're gonna be doing this in class too and all this other stuff, right? I'm gonna check you. And once I check you and go, you're good. This is gonna be done. We're done with it. We'll move on to the trauma or whatever we're doing, right? And we're gonna keep that in a notebook. Or keep that in a folder. Right, and then in your folder, then we can look back and go, okay, well, see how you can improve. Remember, you did good. Or you still need to improve. Still getting this. We got to get this right. Right, and then I'll check you off. Right. At the end of the day, that's what I want to do for A. I want to be able to say, this is where they were at. This is where we came. And there's no, 50% of y'all are probably going to go through this no problem. Maybe 80%. Somebody's going to miss one. I don't want to see when everybody's coming back 100%. I mean, y'all are a good class. Don't get me wrong. You are. But y'all are not. Everybody here is not 100%. Stop. All right. What? Airway? Yeah. I hope.
Hopefully not you.
All right, so let's do that. So we're bring on the squad and work on that. While y'all are doing that, I'm gonna go get our red cards and our yellow cards ready. We'll get this mannequin in here because I'm done with this for a little while. We're going to do that. Then when we do airway, I'm gonna try to teach airway straight from the matter of fact, what I may do is this. I'm gonna try to teach airway. This is brand new for me. Kind of in a way. I've kind of done it before, but this is going to be different for this class. How about this? How about I try to do a video lecture for airway. I put it on, and when you come, you watch that video, some point in time, you come, you're ready. We could just do mannequin stuff. We could talk about airways. We could talk about blah, 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 scenario. Yeah, we could really just say, hey, there'll be a video lecture. It would be helpful if you'd watch it before you come to class. It'd be great. Yeah, I could throw it on JV Learning. Throw it up there. Did everybody get registered? All right, cool. What was the problem? You don't have the class, right class code? Something? We'll talk about it later. No. Bad class. Yeah, it's right more, but wrong class. We got it though. Good. Huh?
But it's just something about like me personally, I don't know about everybody else.
Well, I'm not going to be done teaching. I'm not just going to lay back. No, I'll still be teaching. It's just I won't be like lecturing with a PowerPoint. You know what I mean? I could be like in front of a mannequin, say, okay, this is a common kid. This is a right. It's all we can know. I think if you let me know, and if you like me doing this, I'll be on video doing the same thing. And you can still ask me questions in class. Okay. I'm not going to change anything. No, I want you to ask me questions. I'm not trying. I'll still be as available to you as I've always been. Nothing's going to change there. All right. I don't want that to change either. I like to lecture. It's just I don't feel like with the PowerPoint. Now, I know you're kind of, but I just feel like I don't keep everybody's attention, and I get that. But I'll still present. Still going to give it to you. Okay. This is it. This blah 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 blah. All right. So what I'll do then is I'm gonna go make some more copies of these because we're gonna need some. All right. I'm gonna go make those red cards, yellow cards. Right. While y'all are practicing doing this, it shouldn't take y'all too long. And I'll bring the mannequin in here. Wait, I'm not gonna have time. I'm gonna watch.
I wish I could. I could go right to.
Okay, so y'all practiced this before lunch, 11:30, got to go lunch. Come back, normal 13. They're doing a luncheon every year for Chief Smith, who's not gonna be our chief anymore. I don't plan on like being there shortly or whatever. I might have to break for that for a few minutes to show political break. But I'd rather be here y'all doing this stuff.
Bring us back on lunch.
If there's any food left over, I'll be here. All right.
Yeah.
So if we could just break into squad, do that for a few minutes, I'm gonna go start making these copies, get this done.
Yeah, I can skip right through that PT. What you got there? Off in the bakery bag, huh? What? Chicken burger and mashed sweet potatoes. Yeah, oh, this is what we're doing now?
What we doing now? I gotta change. All right, I'll go first. I'm about to plug it up too. All right, I'm not doing first. Where's my sheets? All right. We're patient. So I know why.
You did really well.
Does he want to like literally
All AEMT. Very general impression.
Go ahead and see the 24-year-old.
See you, Charlie. He's doing 6 inches. I got my general impression. Assess for is there any life threats, obvious life threats? All right. Everything adequate?
A little quiet.
All right. Well, let's go.
Okay, A, B, C, yeah, I'm ready. Is the skin okay?
Super okay. We're a little pale. Sweating a little bit.
You have a radio pulse?
Ready.
Okay. Is there any bleeding? All right. So I'll go into my history taking. Onset, how long did this happen?
About 20 minutes ago.
Think that will make it worse.
Nothing.
What's the any pain?
No, no pain. Just hard to breathe.
Time. All right. Now I guess I'll fix the info. Sign symptoms.
Yeah, I like to.
Bees. All right.
No medication.
All right, let's go.
30 minutes ago. Charlie sitting outside. Sitting outside.
And feeding up to the-
Taking all like this.
just eating outside with the events. Give me the
Oh, yeah.
All right, I'm gonna do this vital, get the pulse on. All that stuff.
So what about
Kind of looked at it. Breathing. Pulse out.
Yeah, so this is 115, virgin moment 28, blood pressure is 90 over respiratory, raised rapid, quality is
Sounds like he's taking. He also sounds like he's in shock. I didn't notice anything on his skin, like any like rash or anything. I looked at the surface.
You didn't see anything if you were first to shirt. Yeah, see.
He gets stung by a bee. I have
There is a checking the
That's the.
This will give you the sign of something.
Yeah, to see, that's why I asked, does he have anything on his sleeve? Is there any swelling anywhere?
Let's say you take off the shirt.
I want to see which ones I don't like.
Yeah, really, but it's so just starting.
I hate on you. That seemed like something.
I'm gonna research this.
What are you gonna reassess?
Vitals.
It's the same.
His ABC. Well, this guy's gonna be a priority. Patient. My real impression is that going into his life. Yeah, so we're gonna transport him, and then I'm gonna, if we need any more epi, if his blood pressure doesn't go up, then I'll give him some stuff. We'll give him another.
Sorry, I was kind of struggling to make some comments. I thought you were just going to put up the list. Like,
Can we do that?
yeah.
Should we do that?
This scenario. I thought you were just going to like straight.
Wants to go next? Me. Oh, let me get mine.
Yeah, that's mine.
Let's do this scenario. Quickly. All right, go ahead. Start it off. Tuesday. MOI, number of patients, and then call back to us. C5. Then the general pressure.
That's probably pretty
Airway, breathing, circulation.
You get to this, I'll tell you what other. Right.
All right, did you say secondary assessment? Or you assess all the body parts?
Oh, I just said.
Airway, what you assessing? Airway? They have inadequate just
But these are just in order.
now
You're just
assessing
an example
circulation.
sheet as an
Which one is there?
because it's in order, it's ABC only.
Yeah.
Jump to which arrows.
So assessing their skin,
Actually, we got hard.
radial, or assessing their color.
Yeah. No sense in going into one just to push more.
This, when that circulation. Anyway, like I was saying, like, you really. Although you want a scenario, or you want to go down there? All right, go ahead.
Yes, I would do all.
You get a cut of mine? Today? Yeah. Oh, yeah, we got. That's not it.
What is?
I got one of my phones. Why do you want people looking at us?
Yeah.
All right, stay focused, Alden.
Oh, I guess
Keep going, Alden.
Airway.
If they got shallow, if they got wheezing, if they got moderate, just like. Say they're
I see so many. It's not even.
yeah.
Blood pressure.
With the vital signs, bro. All the vital signs. Yeah. Okay.
Oh, quick laser.
All right, good job, man. You did really good on everything. NOI. Oh wait, you asked it, and then you went back, and then you went back and got it. So I circled it and then I put it on. You didn't assess pulse at all. So when you're assessing circulation, just remember to do pulse. Also remember the vital signs to get pulse as well. Respiratory rate quality. You already did LOC. I don't know why they want you to do it.
Yeah, I think
Just remember pulse and respiratory. Those are pretty big. Those are pretty big. And then field impression, treatment plan, reevaluate.
Hey, instructor board.
But you did good, Alden. Despite all that.
I'm ready now. It's on top.
Distractions. Go.
Area breathing, there was open, breathing, certain adjunct
accuracy, publication, quality, variation, severity, time, samples, food line, breathing, rate of quality, blood pressure, LC, I'm going on there. And then after that, you need diagnostics, so. No depression. State your intervention.
Oh, no, that.
And after that, the assessment. So we check their vitals, we check the primary survey, see how they're responding, then we check secondary assessment if needed. All right. Missed assess for major bleeding and reevaluate transport.
Read on.
Next one. Real quick, bang this up. Which will pop in? Who popped in? Silver? Howard ran it. Howard. Yeah, or else you would have never known. I would have thought. I just killed him. That was up.
Get a heart attack.
Call it. For real, bro. Rez is like my son. Rez acts like my. No, no.
Well, oh, you.
Yeah, it was also.
Always 64. Just in a one vision.
Thank you, bro. You guys are so happy. Doing this a lot. All right, go ahead, Mike. You gotta go fast. Harder. There people who say harder, faster. No, it's go fast. Hit at the side of the way with the motion of the. Are you done?
Hey, 1300. Hey, nobody was actually talking to you. That's what I was trying to.
So when you're doing your
Right?
airway and circulation, just make sure you talk about.
Hey, go to lunch, be back in 3 piece.
Check your chest size and get those two. Make sure you say that you do stands and clothes. Make sure it's in order. Just try to remember the size of one primary. Just try to keep that in order. And everything else.
I just forget the bottom part.
Yeah.
I mean, it's, you know, it's funny. It's a little.
Also,
Yeah.
remember the secretary. You just do like whatever's effective.
Oh, yeah. They're never gonna land. They're always. They're your stuff.
What's wrong?
I did that same shit.
Alright, take me a second to get down there.
Yeah, come on. Come on. Come on, son. Come on, son. Let's go, son. Take a turn. You see what I'm
You're in there, I'm not really.
I bet. I'll go to AC.
That's why we go on. So you gotta answer.
Where's the key?
Or, I don't know how far you ran.
This is an old team.
Hey, where's your mic? Hello, bud. I didn't see that.
Monte Carlo on top. The red Monte Carlo.
In the boat. Is that the legal? It's legal. That's illegal.
That's the red Monte.
That's too late. All right, girls, we can cover. Yeah.
What they gotta do with it? What they gotta do with it? Hey.
So, you know,
Ain't no bother. There you go.
you can scroll it.
Go back, go back.
Hey.
I'm gonna pull that thing out.
Yeah, okay. Well, now listen.
I listen, so. I mean. Oh.
Guys, this one. Anybody got two numbers? They call it. Permission, not paying. Oh. What's the phrase?
Tell you what. Is it like your friends or one I call my friends? Yeah, what? Yeah. So. All right. I remember you did keep forcing the back first. Keep up.
Already, rice, hot,
Green.
Nobody heard me? Nobody heard me?
You know, you guys in that group chat.
What did you say? See, they give us even. It was that part. Go finish it.
Whoa. Y'all be hearing winners over here? So, I'm gonna say on show. Oh, that's not what I said. Oh. Oh.
Hey, but where, what one of that?
Were you just reaching for the there was no knife? We're not going to check. Yeah, go to that kid. Go to that kid. Hey, just go to that kid.
No, got fast.
I got one. That's three. One minute, I know lots of nobody's flying.
You heard?
Yeah, I got one.
Is it high spot?
Huh?
What?
Six, six, and three. Look, more sorry to talk about. Just in the age, we have to go. Jake, at the end of the day, you know, I never quite.
Yeah, she would.
Be straight up.
I'm not lying. I lost a lot. I lost Friday 3 times. That's
I lost. What's?
yeah. But you only one time. Yeah, we could say. That's what I'm saying. We look back.
Now what? He gonna be like, what? I don't know what it was, baby. Yo. I fixed them. I fixed them. Bro, I don't really care about that.
No, you know what I'm saying? I remember the day she was, I he was like, couldn't do him the whole time he watched the phone. I felt it was bro, I'm not trying to get it to her later, cause like, it ain't because of him, it's like, oh, respect my views. I ain't say that, but man, beat you up that day on earth. I'm probably dead. They was Or you told me how to go buy a bottle and sit on the corner. But I never tried, like you just said, I don't know speak big, but I be sitting there like, well, why the fuck you do it? Boy, they put some shit like you know from the road. Like y'all got bullied in high school, bro. It's funny though, the one thing you can shoot and you kill them. Well, I tell you, if you shoot I don't use my field.
Never played the band.
Like really saying. I'd say how much time. Turn. Give a side. What about it was necessary? What about it was just necessary? Happy birthday. Say.
Hey, witness. See it. Huh? How do you feel so much? I want every. I didn't know that. I didn't know that he was together. I didn't know that he was. But you said. That way you're afraid. That was the one of your heart. That's what you're associated. Like you just on the hug, like you only talk. You said you want to talk to him in school. You might, right? I ain't that makes that. You are.
Oh, no, she's 60. She's 60.
Oh, my sis was
No, she was.
Imagine how sick you would be if you didn't get my screen. Well, that's crazy. Well, I would die.
Oh, you do anything, we'll push your teeth.
Kiss and swoop. Hey, no, did you have that night one? Oh, that gritty. Get like over on that line. That was funny. Tony funny.
No.
Right, and you're telling the story of. That why you trying to take some? When is it over? When is it over? Wayne. What's up, bro? He said, we put, wow.
I wasn't around. Just not heard. I was in school. That's what I'm gonna say. I spit. Seriously. Then she has to go. Man. So then I went to lunch. Like, gee. Like, so, and she hit her head against the stone, and Jim was on foot like this. She's, I guess they were fighting, and the girl's like, boom, like that. Once short, so she's fighting. She's like, I guess, puts her head right there. Yeah, I'm dead. And so on the floor, like, so I have to go. I don't know. So I found it. I did it. I don't. It's all good. Yeah. It's all good. But I never had it. No, you can tell it. That's small. No, she had smack my face. I was like, look down, I was like, she started walking like this. And I can tell you, bro, I was like, so I'm looking, and the mission is right there, he's waiting over there. And I'm looking, and I said, look, she's like, she picks it up, and like, the thing is, my beautiful, you had time, you know, you had time. I looked at the film, she didn't look at the door like this. I like this. It's like that. Right? I couldn't do the thing. He was right. He ran out. I said, shit. I couldn't. She said, bro, she's put that. I said, the next thing she's like, right behind her. Chill out. And then all the other girls, like my basically outside, there was another girl. I was looking at one girl at the time. I was looking at her. Yeah. And when I showed you, you was never with each other like that. And so she gets kind of. So one time we was all out at the mall. So they would all circle around the house. They all circle around. Yeah, all because we was at the mall, so even the mall. And they're all circle around. And it's still running Kiari. K-E-R-I. She said, what? She said, so another said, see, the other guy just looked at me, I was like, this one was that. So we just like, okay, what's up? Yeah, I had a really good time. It was, that's what they heard. Right. Well, that's what we did. It's like that, man.
So like 60.
I don't have a lot of like on my side. So it's fun. I was like, what's that? I just walked out, you know, just like, it's gonna be rude. Put it out. And then I got. That was big. I got jumps, right? I told you. I was like, I got jumps. And then look at time. I didn't know it was happening. And so, I was like, okay, the same girl, man, guys. Yeah, I wasn't even kidding. But I'm like, so I had whatever. So that's I swear to God. Yeah, I'm telling you, bro, I didn't get this height until like COVID. So I was small. I had a little son. So yeah, I came up a couple times. Tell me, he's couldn't fight. But he was big, like I said, football right now. I'm telling you, man, grab like this. I might, y'all would know, I know somebody is saying that he cut like that, Bronco, my whole body goes. I swear to God, bro, I was like this. I think my whole body goes. I got back. What's up? I'm sorry, back. There's that thing right there. He was bigger. I always, I love it. So I'm not the part of the I said, the thing is, he had to die is in that. I know something back then. I said that so my dad came. He said, "Look, you see, walking up, my dad's fucking later on. I'm like, I'm telling you, this is so good. I always do it. I've been doing it hard, guys. I know that. I mean, that's. I'm gonna ask. Oh, now you want to. No, I see. Yeah. I think I got it. Bro, I don't know when it came out from Jamaica. And the only one of that, AEMT. By your job?
I'm about to say, man. Yeah, no, sure.
I hate this types of places that people do strong pushing. Some places, I don't know.
When you say stuff like that, bro, just don't like.
I'll talk to you on Facebook. My first mention you something like I used to be something like every time we talk about it, me and you talk about it.
Okay, you're right, I don't know what you're talking about. I don't know what you're talking about. I'm just gonna know what we talking about. I don't know. You're right, I was wrong. You're right, I was wrong.
You said that you want to love it. Yeah. So we got one. I'm not asking. I did. Oh, yeah, you don't. Color right now. She said that. No. Yes, oh.
Hang on. I got a 70 out of 20. I thought you lived in True.
It should have been at the top.
You got your cars built in different ways.
Oh, why you whispering over?
You pillow talking all?
Got you resistant? What's up? We want to come over here.
Oh, y'all be with them. Like, we could do that.
We won.
Yo, Hall, you pillow talking?
Who's that?
Don't give me nothing. I'll do this thing. What you trying to get? Like I put money in. Basically, you can call it. And no, I ain't trying to go.
What's your thing? What's your thing? Conversation here. All right, Kevin.
Yes, sir. It's home, it's home. Yeah.
Yeah, what?
Everybody dies.
Oh, no, she's just like, fine. She's like, I don't know. I'm just kidding. She said, so I'll be different.
Where's it going? Like it. Like,
I was, yeah.
like, yeah, I just love it.
I've never been up from, I've been.
It is cool, yeah. I'm always like,
I love it.
I don't know. Oh, you wanted my house? I'm like, you're so. Dude. That is sick.
It's just speeding up.
Because you know how yeah. I don't even know. Oh, they do. Yeah.
What's it say?
They don't know how to show.
Shabby dabby.
I was enrolled in college.
I think it's on my clothes.
Need someone student. Every time. Okay. I wanna.
Well, not good. After everything I've done for you. Man, I hope Mason's awake.
So you gotta.
That's what they hired you for. Really? Why? Oh, you signed up to be in. Go to 118.
Well.
That's all his job is now. It's fire prevention. Is he? I'm gonna go watch it later. Too much shit to talk about.
Watching it
Like a cat?
Yeah.
Oh, yeah.
You
What
could.
you got, where you put on the ground, you see?
No, because I don't want a cat. Oh, God,
There he is.
go away.
About to say that, hallway downstairs.
Did you get the demons out of him?
Something like, it's so good.
That wasn't something like, that was hell.
It's games right there. It's-
I was about to send the SWAT team in there.
It's just 165 grams of protein by 12:30. You know what I mean? All that is.
That's a lot.
I like that workout. Yeah. I particularly don't like some of the exercises, but they're pretty easily interchangeable.
Yeah, I was gonna say,
Like, I don't
figured
like-
out tweak it eventually.
I don't do barbell bench. I don't like any bunch of-
Oh,
or
come
bench
on.
flat. Little stuff like that. And then the most controversial thing I got is I don't do deadlifts. So a lot of people say that's crazy, but the
My
rest
bad,
doesn't outweigh the
Joe.
reward.
I threw it back.
It's a great compound movement. I'm not saying
I
that
threw it
those
back.
aren't great exercise.
If you're gonna throw it, throw it straight.
The risk just doesn't outweigh the reward to get anything out of it. To get anything out of it.
Oh, is he gonna fucking
I
give me
need to be close, I need to be repping and close to 500. You know, I put 315 on, I put 315 on. But
What are you gassing
Fuck,
up
I'll
90
walk
for?
home. Like, I'm not gonna get any, so to get anywhere, I gotta go to work.
Your eyes.
And then as soon as you're out of
Got
a
your-
little bit, you fucking back. It's not worth it.
Have at least one.
Boy, they made me play third base in softball.
Oh, y'all win?
It was an old feeling team with guys who've never played before.
So what was the score?
Oh, we got it. It was like, well, it wasn't horrible. We started up normal 8-0, and then didn't score again the rest of the game, lost 15-8.
Wait, I thought you said y'all started off, like, you scored 8 runs?
We did.
Oh,
That's how we start off every game. Cam was being up. Cam was being Dr. Cam.
and we get that scope?
Parker Justin. Fuck you, but look, man, it's so bad right now. Hey, Bert. How was your lunch? Fanny Kimball.
Yeah.
It's cool. It's not you now.
So weird. Huh?
Oh, we did.
Play softball.
Oh, that was gonna hit Dave. Dude.
No, not slip pitch. Slip pitch, you like literally just saw
That. What did you just do?
I threw it.
How did you throw it?
Came in hot.
Yeah, I was gonna tap your hand off.
Hey. So good.
Getting another workout in. I was looking at the Zoom.
Nerd. I'll tell you.
You're a hopping, aren't you?
Oh, yeah. The team I'm like. So you put yourself.
Damn.
Dead ball.
But no, people like if someone's good, you get a really good picture. They get arches. Like, well, it actually depends. What is it?
12 feet.
That's the highest.
I think it's 12 feet.
For me, I feel like that would mess me up.
It just comes in super like if you get the good picture, the ball can really come down.
It'll be a strike.
I just like.
The rules are, yeah. They're only giving them for what? But scoring line.
Ever heard of West?
Thing on Slater.
Dude, you're going to
Hit something out of
I am not.
you'll work.
I used to do like back in high school, I worked
You
at
just-
and I would like score.
They just kids, they were
Fucking gay.
It's
It's
like the size.
not the same. It's not the same. Dude. Volunteer in Georgia. is not the same as Colorado.
No, velocity. Really have to.
I promise you, you'll be the only guy at your station.
Long drive.
It'll be you and one guy. That's how it is here. It's not
About 600 something pounds.
and they think they're fucking gay. And they probably have stickers all over the line. Probably have stickers all over the helmet. We're teachers that say I pipe here. I sound like a volunteer.
You said, no,
So I had to go on the.
Monitor, see star, star, star.
I know.
Which one? I'm gonna do back bounce tries. Do it live tomorrow. What big of a miserable fuck. That shit hurt.
It's all that goddamn lactic acid. You know? It builds up. Yeah, then I'm out there and fucking, you know, in acidotic state, just jogging up and down the fucking road, you know, in hyper fucking pain. You know what I mean? Everybody's in there just fucking fist fighting to get in and out of the cell. Fucking you know, school bus driver never fucking shows back. Yeah. I'm thinking, sorry, son, like bitch. Not a day. It's not a week.
Dude, I hope that, like, man, you gotta understand, like, I've spent so much time digging back in the EMTB. Like, all those worksheets we did, all the suffix, words, relearn the hard. I take these tests all the time. Like, dude, the tests are getting so fucking easy, so fucking fresh. Like, dude, I just took 4 tests on lunch. Lowest I got was a 92. Like, and I don't even have to think.
No, that's all it should be.
Yeah. I just, man,
You do know that information.
hard, dude. I've drug myself with mud for the last 2 weeks.
All right, cool.
Are you gonna take it this weekend?
No, what the
I
heck?
mean, I'm gonna schedule, I'm gonna open it up tomorrow and get the email to reschedule. Hopefully, if there's availability, but the going rate is not. Everybody's saying it's a week out, at least, especially having to do the weekends.
Yeah, that's on record.
We can do it after.
I stuck that shit up my butt. Tastes better, don't it? No.
They got the goal. Nah, you'll be fine.
Hey, bro. You know what? I ain't got to talk. You have to chill the fuck out with all that doctor shit. All right? Like, what did you even fucking say?
It's like cardiac.
I mean, how do you know that? Like, you said that shit, and I'm like, why? Why? Like, God.
A lot of.
Oh, yeah, so come.
A lot of people turn into every time someone was at hospital for chest pain. They order
How do you get that level of blood?
draw blood, draw blood.
When they said that shit, I about 3 months ago. I'm like, fuck you. You know what I mean? I didn't even know what the fuck he was talking about. I'm fucking yeah.
Yeah.
guy at 116 or 115 told me it seems like the PT here is gonna be harder.
What'd they say?
Said we don't have to do 6 inches down there.
Yeah, no shit.
Oh, it's gonna be somebody. That's the one thing I can do for a while. That's the one thing.
The hardest thing they have to do is like 20 towers.
Oh,
That's it. 20 hours is not a big deal. What's that, 15 minutes on Stairmaster? What the fuck is that?
that's true. That's true. What was that dude that was telling us? He like ran 7 miles one day. Whoever started walking during it, they made all the towers. 8 towers for each person that was walking. They said they did 3 count push-ups. I'll be sitting there like.
But I'm not.
I'm glad you said that, but I think you're just gonna breathe by it. You're gonna be
I'm not that good.
Hey, wait. Wait. Yeah, no way. I mean, I won't even see you when we're there. I mean, down at the bottom of the tower.
I'm not going Boston.
Oh, you're upstairs.
He's talking about that's all. I'm sure we can do.
I don't even know you're there.
I know one day you don't want to do all. But he's like really short.
No, it's fine. Hey, Parker. No, it wasn't. Remember that one time we were talking to one dude that graduated from the CD state? Yeah, the younger was like, right, it's not really bad. It's bigger. Not like swole. It makes like just a bigger dude.
Dude, there was always on the distribution.
Yes.
That ran that.
Yeah. Not the black guy.
He had a weird name.
That's what I'm talking about.
Yeah, he was just here.
Yeah, I'm talking about.
Oh. JJ, what's that guy's name from 115 that was always at the food drives?
Which one?
The big one who always was in charge.
Oh, the guy we talked to.
I wasn't talking to him, but yeah.
I can't remember his
Really
name.
not much to pick for.
You're useless.
He had a weird name.
Yeah.
Yeah.
Man, that would be cool.
They call him grandfather.
Yeah. Just something. He's the one that lost like 30 pounds. Because he had never done physical activity. Yeah, he lost like 30 pounds in high school.
I'll probably just go watch it.
So why do you send me videos on group? Next thing you're like, get my number.
I probably. I thought yeah, I mean 30, 40,000 steps a day. And actually walking.
I mean, but there wasn't enough evidence yet to go on the ball field. I mean, yeah, you worked it.
I mean, I can lose like 10 pounds. That's about max. I don't want to lose a fire.
Where were you at?
But I'll fix that shit every day on the way home. I didn't know where you were. Touching myself. Hey, Bear.
Quad is like, what does it feel like? Like the chest pain and the charge. The severity is like greater. Easy I just want to look cool.
Pretty much said it's not even a big deal.
I guess we did see some people that are coming out.
I think
They don't give a fuck. They'll just make it worse. Just make it harder for them.
Right.
They're raking through everybody. They don't look that. Looks bad on there.
Yeah, but if they have shit back going, yeah. Shit back going, don't be for sure. But
Oh, it's fast. Do we fast it? Oh, like fuck you.
He also said that like apparently with radio, $3,000. Start working on it. Like, don't be surprised if you see people do that. Sorry, dude, but $10,000 is not worth it.
yeah, not at all. Yeah, yeah, we already got it.
Well, it's another $3,000 though.
Yeah.
With the fucking bird dog.
Yeah.
Every time you go answer calls.
I'm trying to get some more beans or something. It's like an underlying thing. I feel like maybe this might have been the plan from the start, though. Since, you know,
I think there's always going to be more to than that was planned. You know what I mean? Oh shit, I could go college and make it. Or I could go here and get paid while I'm doing it and still leave.
but if anyone does that here with us,
Florida doesn't recognize AEMT. Is that where? They don't have AEMTs.
They got EMTs and paramedics.
I'm sure your scope of practice in EMT is probably like doing IVs. They said the same thing in Colorado. It's an EMT paramedic, but EMTs do like a lot of airways, IVs, and shit. So.
I was actually looking at getting a part-time job at the VA. I'm fucking all right.
It's not nationally tested.
Because as an A, you just like hang out at the VA and give oxygen and wait. So you can do the game.
I want to do that like that.
Go out there with a car, you know, say,
I want to do like the high school sports league over time. Fucking box, high school fucking like private events, like concerts and shit.
That's the shit right there.
About medication.
Yeah, like if you didn't take the medication with him, he said you can figure out the thing.
What?
If they're unconscious, yeah, it makes sense. He's not wrong.
You're not wrong, but I know it's. I'll let Dad out of my butt.
Dude, you need to clean that up. He's got so much trash in that drawer. It's just trash. It's weird, so I throw it away.
Yeah, man, I'm so excited.
What is that? Oh, yeah, that's gross. Still found it? Huh? Still found it? Because the only time I was sober.
Anything that was
using
my phone.
I
think it's fine. I can't stop it. License. Cash. I mean, it's not like, it's not like. There's a normal gallon. Seal carries in there, my license, my. It's so good, like, that much, so much.
What?
Oh
my God. Chill out, bro.
What's up, what you doing?
Out of my car.
I was wondering if this is you can sneak it in your
Morris is really gonna bring it
Get that video in my office. I purchased this bunch of this increased workload, right?
We have increased heart rate. Heart rate.
Didn't you say it was large though? Cardio. No way he makes it. You talk shit, you drink it? It's whatever. It's like 90 grams of sugar. Yeah, it's like all it's a lot. So like, I think it's added sugar. It's added sugar. Like it's not. It's like refined, like sugar.
I get to 3. Let's go 4.
I'll eat out. Stuff like that. It's all a lot of this shit. It looks good.
But they charge so much.
Yeah, I just take it. I take
both live 3 oranges.
Your elbows.
That's exactly what
Small job for us. Yeah, I can see. Yeah. He did a lot. I never got super into it. It's a game to see, man. OG. 5v5. I never got into it. It's kind of like, do you buy shit now, right? There's like money, economy. You could buy like not like in the game, like you buy your guns. No. Okay. I think it is though, like each character has like a certain ability that looks like a tank. Okay. So it's kind of like Valorant. I feel like it's the OG Overwatch. Yeah, right. Yeah, that's better. That's better. So. Overwatch? Yeah. Yeah, I never played it. Overwatch, never ever. I didn't like it. Oh man, CSGO right now is just. Right now, I'm getting close to 1,000 hours. What? CSGO. Counter-Strike. 1,000 hours, man.
Wow, what an accomplishment.
No, it's not at all.
It's fucking sad.
Wow.
Impressive. I want to see what he gets. What can't you like take a subscription? I need to cancel that. I got to like 15 something. I left mine every day for like 6 months. That's it. Terrible. You serious? It's like $16.
I took my wife's debit card and attached it to my Apple Pay, and every now and then I buy myself something. She never does. Only like from common places, so. You know, it's gotta be like from Walmart. Yeah. She doesn't see it. Because if this was normal. I can't like go by and stuff. Moderate that.
Yeah, I guess a lot of shit. I think
What?
I think we took off. You're probably right.
I'm let it.
It's fun. It's fun. You'll suck your life away though. World of Warcraft. You think I created? Absolutely. I feel like anyone in this room can get into it.
Really?
Yes. You actually like put in time and got good at it. Yes.
You're talking to a guy who doesn't want TV, play video games. You're telling me I can.
It's hard to describe, man, but once you go to like a point where you like grab clicks and you like chat. It's fun.
Is that only on PC?
I'm telling you, when we first started playing it, you'd be like, this is that's how I was. But I'm not joking, like it was like having a second job. You get like to the part where it's fun. So you like guilds, you're playing with like a ton of other people. It's like massive. I mean, it's like you have to work with like 20 other people to like accomplish something. Like you literally
They
can't
get
do
mad
it
at you and you
unless
don't
everyone's
do it.
looking at the same thing, doing like one person fucks up, everybody fucks up.
You feel guilty when you miss the day because everybody's mad at you, your team will go mad.
That's how I was in high school. Not now. I would never say how much it takes. People, when someone says, I play World of Warcraft, I don't understand. They understand that they're playing for probably like 3-4 hours a day.
I don't know, a lot of people.
Exactly, man, you can't. It's funny as hell, but like I would never go back to it. Ever.
I'm like, you know what? It's 6 o'clock. I want to be on the end.
Yeah, exactly. I'd rather do other things now.
Yeah.
I would never sit at a computer for 4 hours on board.
No. I don't sit anywhere for 4 hours. I go try. Still to this day, I get the itch sometimes to like whip out my old Xbox and play a game of Madden. I ain't got shit to do today. I'm gonna pop up some Madden. I play one game and I'm like, fuck this. This is stupid.
I mean, that's how I am with this. I started playing. I got hockey too, but 3 games, 2 of those probably hot top and died. And then the third game, I actually played. But I'm contemplating starting the next game.
I don't have that problem.
Did you ever get good at PvPing well?
No, it's dog shit.
Oh, God.
That's all the juice is too. It's juice. World Cup, that's where it's like the raids are really big. Like PvP, it's like it's a whole different scene. It's where it takes a shit ton of them to hit. How many games?
When I do my go-to theory since the day I started weight loss, like when it was originally weight loss, and then it turned into like, oh man, I'm gonna be able to get some muscle now, I should eat protein. Now it's now let's do steroids and they're big. But my theory from Jump Street was always, if it came off a tree, out of the ground, if it was grown, or it's an animal that walked this earth, you can eat that shit. People are going wrong because they eat box shit. They eat candy, you know what I mean? Like if it came off of a vine, you know what I mean? That's always been the theory. Are we playing soccer or this is for assessment?
This is for our area.
That's the only thing I know about soccer.
I do two ball.
I do not know the rules at all.
No,
But I love going to the league.
Bro, I want to go.
I'll get you
Next time
The atmosphere is wild, bro.
I know it is. I'm seeing it on TV. Like,
Soccer fans are hard.
Don't do it.
Unless it just.
This place is good. That's all. Yeah.
It's just full of like.
It's not my day. Yesterday was my day.
You're watching you right now.
Oh, anything else?
Run.
Right. He lives at 7 stories. We should have something first. I just remember, man, I was so stoked. I just remember getting on top of the that was like my like, yeah, that was like my test. No, I'm not that. I'm just more so just like,
Out there looking down like.
yeah, fucking sweet. Sure, like close to the city, it's like 4 hours. I know that you're telling me they have like one station all they do all the time. Carrying I mean, depends. I know they have the one with the buckets.
I'm still trying to think of that kid's name. I call him in my head. It's Stinson. Like, I feel like it was some sort of like German last name. Like, I know it's fucked up, but it's all like keep popping in my head.
We just want to go like 14.
Yes.
I don't know. He's with the food drive. I was like, everyone I normally do food drives. And I was like, man, what do you think?
And do you feel like
It always hits you.
what's that?
No, but fucking.
Bro, he's calling me so weird. I was like, oh,
Well, my mom hit me with that shit the other day on the way home, man. But I'm gonna
I gotta look, I have to leave. So we're not gonna have time to do scenarios, but tomorrow we will.
sweet.
We're something about like being worried about something. Everything I'm worried about is where all my kids are going. That's what I pray
That's so
And I
cool.
just, what sucks is I just don't want to argue with them. But like, I was an assistant. What? In my mid-20s. I was an assistant youth pastor. I took over 100 kids to 4 different youth conventions all over the world. I've been to Indiana. Yeah, dude, I was serious. Indianapolis. It's crazy now because I don't argue with them. I don't
Where's my girl? Go to Temple.
I'm so sorry. In a form,
So serious.
whether that's God or whatever. But however, I don't think anyone who wants to follow and live by the Bible. I don't think there's no repercussion. Like, it's never let anybody down the wrong path. Right? So I just don't know if I believe it. I believe it's just like, so what's, you know what I mean? And then every time I tell you that, so explain that to her. She's like, oh no, you do believe. You do believe. You know what you're I'm like, no, that's what I don't. Like,
I just.
You know, outline 15:30. Like y'all do. If y'all stay, kind of keep the noise down. Don't draw any attention. We got 2 deputy chiefs on the floor right now. And so I don't see them coming back here or anything, but just saying, you know, y'all keep the noise, then y'all be fine. Y'all can do your study guide. Water Solutions is fine. And tomorrow I'll have the man come in here, we're gonna play it.
We gonna get it, setting up for next time. too?
Yeah, I'm working on it now. I forgot. I had this one today. Have to do that. And then come home and try to talk to another guy. These sucks. I mean, some of them actually be good.
This works perfect for what you want to do.
This is the move. This is the thing. I'm gonna carry on. I'm gonna start yellow card.
I thought you were taking it away, like where everybody was out here. You know, so.
And what's gonna happen this time? You're gonna have to step back and tell your direct your team. Do this, do this, do this. So that's kind of.
That's what we're doing.
Yeah.
That's the bulk of
That's
it.
Mostly, I will.
I like this. Just a quick thoughts and rundown through what the important stuff is. Even then, by you, I think it's gonna benefit everyone. I just realize it because there's still, there's always watching someone do it well, seeing the sideline conversation, which takes away from that. When it's just you in your office and the microphone, streamline right out the gate. There it is. Because you're in that thought process. Everything streamlined. It's all oh, it pulls your attention. Yeah, it pulls your attention. Sure. It takes your mind off the crap. You get the streamline.
They also want to.
That's not good.
I think that's it. I run 5K.
Quick 25 minutes. I'm excited to do that. I gotta remember this.
I was gonna do it last night, but I was worried you guys weren't serious.
I'm excited to go like Atlanta's finest.
It's like some sort of.
Yeah, that's what it is.
Gonna be, what are they gonna hold it?
It's a card.
Yeah, Olympic.
I think it's for, since APD does all the stuff, for all the runs around that round.
Right. Right.
That's the airway before you.
You need to start starting up with this.
I did 10K with Blue. Go for it.
Yeah, I got my registry right after.
Oh, yeah, my text too.
Okay.
I wanted to get them before we did
This is just a piece
One of the testing things, I think it's Brad.
You're not going with
I can monitor the progress that we have. So I can watch the student, I can look at the performance.
Pull out.
Pull out.
It'd be easy for you to notice what they're missing.
Right. So
That's great.
I'm gonna look at that.
That's sweet. That's sweet.
Oh, no.
And some people need to account.
Donkey.
Oh, yeah.
In the heart. And then just the way I was taking it. Not really putting this into play every question.
Now it's only really not
Yeah, really understand. Actually, Suda sent me a video and really made it all quick. And then I come in the yesterday, yeah, lunch. Now he's like, now you understand. Nowadays, and I didn't understand it. You come up here doing that.
Oh, shit, I
What do you
didn't see that one.
I was so
I
lost.
missed that one.
Now it's only good. Makes perfect sense. We were talking about their resistance getting back out of the way. All clicks. And then I went back and printed out all the sheets you made, like early on, suffixes, terms. I feel fresher than ever. I don't think there's a test that we even took. Yeah, for sure. That's crazy. They created that bank. They created that bank of persons, but nothing's like.
I'm not doing it. I'm gonna be more. I respect
I think one of the biggest setups, you know, for me was I felt like I told you this morning, it's just all the testimonies are set up to memorize signs and symbols, to know, to attach it to something, but no understanding of why it's happening. Like when we started doing the immune response, in my mind the whole time, every time you'd say something, this should have been 3 months ago. This should have been with me. You know what I mean? Like here's anaphylactic, here's the immune response. Like here's what all happened. This is why this happens. Not like this happens, that's just simple. You know, and so then I felt like attaching signs and symbols, how you have to learn. And now instead of working that way, even I still can see all the types of shots, the big board up here. You like it a long time, and all the signs and symbols, and it was like trying to memorize the signs, you know what I mean? And now it's like, why was not this question right here? I just come in and say it. But instantly I look at it and I see I don't believe in shot. You know, I just want to, I just feel like I know the best. But then you think you have fluid. Heart's going to do compensate.
I'm so mad about that.
You're like, you know, he was talking about waking up like,
I'm not playing with it.
obviously.
Yeah, that's all.
Even if you don't know what to do. So you can walk through the process.
Take that to the bank.
Cardiogenic.
I just wanted to be clear, that's the only reason we live in a car.
It's for everything. You would get
You know how to show. I mean, put you on.
yeah, no, it took me a minute to think about it, but yeah, I had to walk through it.
Questions, they give you such little information. So you really gotta like, really gotta know the
You have to know that
because they're not gonna.
response, you gotta know the process.
It's not gonna be like, this person, whatever, they have a history of this, they know what it is. They're so subtle about trying to figure out where you are in the sheet.
Yeah.
I got four right here.
That's testing.
I will talk to.
Is A the same way? I'll get you off whenever. So it's like, oh, it's in the nation. I just add stuff
We took care of that too with our other guy.
But
What you basically?
it helps you.
Yeah.
If they go.
Later, like that car, you put like that.
Tax it.
I won't be here tomorrow, so give that to Lindsay and tell her to type it up for you.
Oh, boy. Yes, ma'am.
Oh, boy. All right, so then, so yeah. I wouldn't. Then they'll be.
But don't worry.
We got
What other?
do besides super robotics or
Super glide. I'm gonna show you all three of them.
I mean, we can't put them in. We just don't use them here.
Why,
How many bags they got?
They use the car. We're gonna go back. Oh, you
That was the back six medics.
got 30.
One of them was, I was doing compression here next to him. Yeah, he was next to me. He was just an eye gel. And then his back was actually putting out his mouth and stuff. And so you literally just take this and you push it out. The other guy started pushing it.
Perfect.
It was like, I just didn't even think. I was like, I didn't know what it is. It was nice to see too, because that little hole, you know, it's.
Yeah, I like that. I was like, if I was doing something like an ideal race, I could beat it. And then race would take it.
I was kind of wondering because they already had him intubated, so I don't know why they wanted to take that out. I just instead.
I was like, but
Unless they didn't feel like they're too.
Oh, maybe not.
What is the basic?
Right, man.
What is the basic? Once you put in you're doing CPR, you stop, put your best airway in. It's a continuous.
What's up, bro? That's all right.
It probably has something to do with it. Puts the rest of pressure. I guess.
In one breath, like 6 seconds.
Well, yeah, well, change out every 2 weeks. Change out.
Oh, right, yeah.
We're talking about
Let's go to with this, which
Oh, that's the truth. The field has-
That's what's gonna happen.
But it's not good because you think you're doing good.
No, you've been doing it so long, it just
Yeah,
becomes,
you
you're
start-
just this.
start slacking out, you don't realize it. But I get in the hospital, I'll do some of the girls.
Well, I remember we got to the hospital, nurses took over my question, she's,
Yeah.
and it was like so slow.
Oh, I was like, I don't know.
Did you, way more than you God, your compression sucks. Shit, you're so. So many of them. Are we doing ER clinics? This time? I'm gonna get me some scrubs.
This guy.
No, I'm not talking about.
Y'all feel right. I will push out. I thought, but I ain't gonna bow to
It's minus 50. It's minus 50. They don't give a damn. I don't even, whenever I keep score, I don't give y'all the 7. I just take shit. I do that to myself. You don't get 7. It's y'all bad.
Maybe y'all just.
It's like you're.
You ain't working. You don't work.
That's why I'm like, it's not to be a game.
What's this going on? Oh, yeah, y'all been unless y'all just be talking.
We've been going.
I was gonna be y'all.
It's only Washington.
I don't know. Got 70 minutes. Huh? Got 70 minutes. For 3. Yep. Yeah, I watched one of them 20-minute videos. Finish that channel and look up.
Oh, yeah.
Yeah.
Pull up multiple
Same.
windows and watch them all at the same time.
honed them out in the field.
That's what I heard. That's how you do it.
Essentially want them to backtrack and get it. That's asking. That's asking. Yeah.
My girl, they are good.
I got to fire for it.
Well, no, they're already.
No, they're like, oh, fire. That's what I'm saying. Yeah, it doesn't make a lot of sense.
The baby, my girl.
Because you're dying for all your P's to be A's in the field.
You can do a list.
Your lab, that will be happy.
You think so?
Oh.
My kids right now, they're not all.
All property.
My son is, my daughter is. My son likes jujitsu, together.
Just show up. And go to fire. Oh, they're already fired.
Hey,
Yeah.
listen.
Get the information.
Yeah, fishing poles.
They do it on their off days.
30
Right?
ounces.
Yes, and I do.
I don't know how to put some ground mold.
So they're that takes a
That's
toll.
right. Yeah, the game.
Hundred thousand per ship.
Like whacker. Yeah.
Right. Yeah, I mean, you know what it's like. County's good.
Fixing,
We're gonna put some out there for those guys. Because why would I go? Why would I go kill myself when I've been firefighter for a while? Like, what? Oh, come in on my days off for what? Oh, they graduate, you know, 10 days off or something. But right now, I should leave.
It goes slow, man.
Well, that's what I'm saying, yeah, 16%. You'd have people, want to do it.
I don't think I get you. I might be able to get you.
It's great for me.
That's all.
I know you got some. I know you got some.
Everybody's got the same meds, man. Real meds.
Not here. Got whole time.
Right.
He said,
You really don't need to.
Big deal.
It's either they get
But they ain't.
I hear ski.
all I'm trying to do is
Yeah.
That's why they talk to you.
And that sucks too, like for, the shift wise, like once you make it somewhere, you got a guy like you who's on B shift, right, whatever. That'll be- you're the only paramedic. Everybody just turn around looking at you because you don't have enough. So then that guy's just getting dragged down. He's like, like for what reason?
So everybody lined up. Ask my away from each day. They're always like,
That's the gayest way I've seen in a long
That's good. I was gone. Really gone. And they're one of those guys.
Me too.
What are you doing?
Hey, man, pick one. I'm sorry. You can't do that. You need to drop one. I can do it right now. Go ahead. I'll let we got talk.
I wasn't laughing because the guy's dead when you said that. It reminded me of that day when you were talking about the old heads in the conversation. And you just said they got Bobby Perry. Remember you said like people always just tell stories about.
Yeah, Bob Perry, yeah, Bob.
That's what I said. He said that like it matters. Like I
Bobby David Jones and Lester. We were on this damn fire at the gym and blowing out.
That's an excellent. Lester is like, yep.
Oh, he was back there hard.
Sir. Thanks, sir.
Alright, guys.
Where is that? We sit on the side.
Still continue to catch that. He threw down the king of spades. He threw down the 10 of diamonds. 10 of spades.
Wow.
Dude. Yeah, he threw down the king of spades. He knew it very well. Dude. Yeah, maybe you ought to pay attention better. Hey, at least I'm waiting for y'all for them to get up.
You're literally, you're about to stop.
Yeah, when he put Campbell's card in, you did the
You know I would.
I know your mom be over there. Is it his name?
No.
Y'all just do it down there.
Down there, you
I'm hot.
I was waiting for somebody to say something.
All that fat ass. Nothing left.
But they can really get.
I gave you a learn lesson today. No. Here, Stephen.
No, just win.
Oh, yeah, we don't have. Oh, no, you'll see.
Yeah, because I'm on the sideline, so I can. I'm talking from the beginning.
Oh, I'm gonna go.
I'm talking from the beginning. Oh, yeah, what you gonna do? Yeah, we know.
You'll see what I mean.
Yeah, you'll see. Actually.
Oh, no, you did all.
Oh, wait, no, I do have one. I ain't even seen it. I didn't say no like y'all used to submit
So you got one of those.
Yep.
Hey, y'all still talking? Hey, don't worry about us.
Yeah. Bradley. Man, piece of game, bro. All I know is he told me, bro, we're gonna go watch the movie. People were saying, he invited himself. Came out here to invite himself. Not with us. That would be him. He said, "Oh yeah, I'm coming over there too." I got the movie already. That's exactly what he said. My best friend said he's my best friend.
What? 14?
He said, "I
Has
already got that
Martin
movie."
has to do goodbye. Oh, really?
I ain't gonna say no.
I'm trying to do it tonight. I'm hauling it again. Leave all the people. I just gotta figure out how long.
Nah, we do.
Test. You can do it. I knew you can just look up the name. I knew one had. I know Brad had.
Bradley be over here, ladies. You get big eyes. You do that, and Cheryl be over there.
That's how I know
you got fun. You be like, that's it. He be like, Campbell does this. Campbell does this.
Especially since we're working out again. The only carbs I've had at all. I won't be this happy. Catch up. I cruised through the day. Yeah, it ain't nothing. It ain't nothing little turkey sandwich in a bag of cheese.
I've had a bag of cheese like every night before bed, like that 4 days. Just like the kid size whole bag. Just need about the smaller ones, the kid size ones, they're 90 cows. Yeah. Don't sacrifice. The thing is, man, I wouldn't sacrifice the workout. You know what I mean? Like if you're dragging ass through the workouts.
3, 4, 5, 6.
Like, don't sacrifice that. Because the work you put in there pays off. Duration. So not eating that little bit versus letting your body grind the rest of the day. It's not worth it. Oh, I mean,
Y'all.
Damn, dog. Give them the big strokes. Yeah, not the half deuces. I think I'm gonna keep take a test.
Yeah.
Damn, but I ain't.
So, but like you said,
You were 17.
keep me.
Bunch of fags. I love it now.
So you think that work? Y'all need it once.
I'm just back.
I'm doing too low.
My phone. We cut it, like, a couple months ago, to use that. That come cut it with you, that did we cut, that's really.
Oh, what you got going on?
He told me to call my cousin. I said, oh, no,
I somehow deal myself the 3 clubs all the way to the 8 clubs. Yeah, I wasn't expecting that clean.
This landed. Yeah, I was like, hey guys, get.
I had 6 of them on.
I like it.
I had 6 of them.
I did.
What did you do?
I gotta go get my military ID.
Oh,
Yeah, you gotta write it right.
I forgot about that. No, what was this?
I said, so am I gonna deal with my military? No, that's it. I said, I'm performing a duty in the US military. So I can't do that. He's like, well, you're only gonna be gone for not that long, so don't worry about it.
How long does it take?
I mean, it's not.
Campbell Common.
I mean, I'm trying to come back. I'm just checking.
One of us in the
I'll be back by like 11. It's towards the end of August. It's just that when you can just go in, just put your fingerprint on, and just reset the I don't think we got it. March is long. Not at 40. Oh, yeah.
I'm doing a Bradley.
I'm trying to.
Whoa! Ain't no fucking this. Bro, what?
Hey, bro, I went to the same.
How many you say you got?
No possible, no ifs, ands, or buts about it. I mean, together.
We got straight.
You got all the aces. The twos, both jokers.
I'm going through my hand right now.
If you don't have that.
It's like the sixth person that came saying that shit. I never heard you talk. Wow. Just throwing the game.
How many do you have on?
It said 2 hospital.
Wait, you should have got 2 of them. You could leave it to me, you know? Like Decent playing the card backwards, he going 7, 6, 8. Instead of like he got 5 spaces, he need to take it from the top.
I have 1 bullet. That's my bullet.
Like you just playing the big space, the way that you gonna got it.
Those are the ones that I played to draw the big ones out.
Not the only big say I had was Queen and that Joker.
Most of the ones I threw out to like try to draw the higher cards out.
I hate that. Yeah. It's that bad.
I think you bothered to get 50 right now.
Nah, not to you. That bothers me that I have bad luck for all those games. Doing some minutes, 12 books out here to come back. Shit. Come back and win it. Get out of negative.
How many books I get back? I was losing my hand.
Dude, I was like, who has the Jokers?
I only had 2 weeks saved. It's something.
Yeah, I agree. Those are the ones I threw out, like the Jacks.
So I knew.
Yeah.
I knew.
Because like I think the Jack,
all they had you on my house.
Spades and clubs. They somehow wrong.
I kept looking at my hand. I said, "You only got 1. Ain't no way."
No, I kept looking at 3.
Oh, big difference. He played that when he played off at yeah, that's what.
See the whole. You could have read that.
Playing off. Oh, time up. I learned
I actually didn't read you wouldn't fit in read it.
I didn't. My brother sent it to me. I didn't read it till years later. It's always here. I got one of the policies.
Got one.
You don't win if you go to native. She's digging for gold. She sniffed it. Yeah.
She sniffed it. She sniffed it, but like as a slick, like she just wanted to think, you know what I'm saying? Bro, I saw it. A homegirl was right there in the middle of the park. She hit the. I don't like that her hands they go like this. Ew.
That's can't count.
Yeah, what, bro? She just wanted to be relax.
You got one pop, you think you bored.
No, but we out the game, bro.
You seen that?
I got one in the pile.
You probably get five. Yeah. And about what I got. Okay. So we on time.
You know, I'm not gonna let you know.
Is that like a saying?
I think he was trying to be cool.
Don't do cheat.
I think he was trying to be cool, but I think he was trying to be cool. Come on, dude.
We'll take it like.
Yeah, you can't say anything nice.
He's saying that because each time I'm seeing this.
Oh, it's got a diamond.
All right, Aldine.
How much do y'all need to wrap it? No, yeah, I'm not. Like, I don't like the American one. I like the one with the all metal, but it doesn't feel.
Not all.
I'm like,
Damn.
Where did you guys go? I think that was.
If we get extra money.
You guys got in? And then y'all both take.
They go 170.
Yeah, no, they, yeah, you got time.
They go 170. I want to call them. Yeah, I think that's- 16.
No, we got my ass.
I didn't know.
Oh, yeah, one of the.
Oh.
Bunch of different.
Okay, I hear
I-
what you talking about? What would like sleep like?
Let me get up.
Oh.
I'm looking at Brad up there.
You know how much I need some help with women.
What made y'all want to be a fire?
I want to serve my community. I needed a job.
Now, what answer do you want?
I used to know when I started.
It's probably fine.
Oh, God.
I don't know that one. You got a job.
It might be able to do that now. Two bucks for two. So three. Oh.
I'll get you one.
One start.
One. All you must have everything.
Sorry, go.
Which I go? Oh, there you go. Hey.
Are we going fast?
Yeah.
Oh, no. Only got one.
You got one. Yeah, I did the first You can still come back. Dude, when I was on against Canada, we were up by like 200. Yeah, let's play Canada. Yeah, we did it.
Yeah. I just.
Where you go?
I need something. Later.
You probably had the A's. Brother,
I remember how I got fired.
DC just released that Robin.
Who?
Robin.
Which one?
Robin, DC.
No, which Robin?
There's like
what?
four.
There's
He said, which one?
the one from Batman.
Robin, I don't know. Robin, I don't like DC.
There's like four Robins.
I understand what you're saying. No, dude. No.
Screw him.
Oh, no.
Why?
I don't install that.
Make it shit up. Where I work.
Gay history, what it's called.
Okay.
Don't jump your man.
For that, I was
Show laugh. No, man, I'll be.
No, it's a good job, bro.
It sounds crazy. We don't feel that.
I mean, it's just it's a retail thing, but they got a bunch of stuff that's like.
I got negatives.
Yeah,
Well,
Only 124.
Yeah, we got.
Dude. Hey, man. How am I lying? We got exactly what we got.
You can't be your.
Well, Bradley, you probably got like what, one bag.
That's a funny way to say it. Hey, don't say it out loud. Go ahead, don't say it out loud.
You know what, Harris? Help out Dixon. Let's allow it.
What you told me?
I'm sorry. You be first.
Y'all only get books. I said, I got 6 in the pot. I got my 2.
But you know what worked?
He just saw other things. He got serious. Five got 9. I ain't never seen that.
Why would you go 11? Bro, can't you be seeing one book? I get one book. I get one book a day.
You agree with that?
Yeah, at least it's not a lot.
I
keys, and I'll come back.
I got 2 in the pot.
Yeah, we on.
I remember that shit. Yeah.
Got two possible.
You got off stage.
Oh, yeah.
You got 2 in the pot.
So let's go. Oh, let's see.
You got one, go ahead. I
Sure.
got mine, I got mine.
Okay. Yeah.
No, go away.
No, let's get some. So,
Just end it, bro.
okay.
Oh, Dixon. That was a mistake.
Who got all this?
I didn't see anybody saying it, but I just, that exchange.
Yeah.
I'm not about the bag. I'm not about that.
Yeah.
There you go.
I swear to God, tell her.
Stay logical.
Hey, let me see. Oh, you back here?
No.
Swear to God.
Come on, bro. I knew one would be good.
Let's see what it is.
And all of it.
No, wrong. I mean, what he said.
So do you want to take off? I know. Oh, I never even think about it. What's in it? Water. I don't know.
Cut my partner.
Yep.
Not that one.
Still,
We threw out the bid.
What'd you throw out, Audie?
Small.
No, on that hand.
That's what you got.
I thought they were doing two.
He thought, hey, you me.
Me? Ow. Ow.
He threw out the seven. He mad with the.
Yeah, they're at the seven.
He said he threw out the seven.
I always say you like they said.
I don't know what I know.
You, I mean, they didn't get it. Even if you
Okay,
I don't remember. So you say give them three?
No matter of fact, Nixon threw out there seven.
I did not go out there, 2 hours.
I did. I thought about
Well, actually, he did because he was paid.
Only had one spade, only spade my
each way, one of those was a heart and one of those was a diamond.
No, right, he threw out one. He played off.
Only had one spade.
If Bradley threw out that similar spade, he did.
Diamond.
Yeah.
So if I threw a diamond, the diamond was the first one to go.
Yeah, he played off.
Yeah. Then why are you saying the why we
You want him to I know you're gonna talk damn all.
Is he still sick?
That happened to me. We're not getting the food.
You'll definitely get more.
Oh, really?
I know, man. Hey, y'all don't need to play.
Good shot.
You did, okay. No, you did it small.
I do that.
Oh, okay.
I had a small.
Oh, yeah. That's
When I saw you from the big guy, when I saw you throw that big guy, when I threw the big guy, you shot back on the whole lot.
It's the same thing that one girl said to me that one time. She said, you threw that big out. I was hoping you throw that big out. No. Yeah, that's what she said. She's like, I was hoping you throw that big out. Yeah.
Yesterday, we couldn't lose. You got beat by Dixie and Orange. You got Boston.
I'd rather get beat on first hand than going to the next.
Oh.
Not just like negative.
It would be like,
It was more than three. See, I lost. I got dropped. Exactly. Dude, I saw part of his hand. I saw part of his hand. We said board. Yeah.
I always play his best.
That's your
Oh, it's all about respect.
I respect you all the time. You a little sick. Because I'm winning. Hey, you can't say gingerbread isn't good.
Y'all know his red-handed ass still selling motherfucker eats gingerbread. I don't know why I'm mad at him.
I bet you got that cinnamon broom in your house.
What?
Cinnamon smelling broom.
No.
All the grandma got one.
That one you get at the Dollar General at the checkout. Hey.
I want to throw them dogs.
Like little witch.
Smell you hanging out in a bag of fucking maple brown sugar fucking oatmeal. Yeah, bro.
That's probably the reason I was like, grandma. You can say all the way back.
I gotta get
They want people that.
Come on, baby. Letter. Give it to Mike.
Yeah, but the time goes by.
It does, that's crazy. Sure, I told him,
Like, give us a favor, like,
what's that called?
Oh, they not just on email.
Send her a text on the way home. She got surprised. I don't know what it's gonna be about, but
Yeah, like some ass.
that'd be great.
I'm not going
I'd
on
rather give
dates.
sex than that.
I'm going off with. Right.
And then, and
It's
then,
all right.
and then you can be.
Oh, boy.
It's a full house, dude.
Yes.
It's
very
full house.
many kids.
I'll get jokes. I was looking at your phone.
Oh,
Yeah.
you know what a full house is good for?
I don't know, she's about to.
Oh, come on, dude. You say music.
Dixon, come on.
Is that what you're thinking, Dad? Oh, I think you're right.
I think we can just call this.
You're out. One bullet. Call round conservation.
Yeah, got heads. That's pretty something. So bad. Follow job is our coworker, 40-year-old dude. He was a second and joined like right before 9/11 happened in the industry. I think he did like 3 years out of Afghanistan. He did a tour back before he got out.
It's different though, like even to this day, I don't understand how people. I mean, anyone that like,
We got
the fact that me and you that's what no one.
All we need
That's the scary people. Oh,
Ivan.
Nothing there. You know what I mean? Hey, make sure we're all outside, out front, 15F. Make sure you pick up your stuff, like your cup that you're leaving for us. Yeah. Well, you did.
I can get you.
I'm definitely going to the gym. A little bit back. Maybe just water all the way around. Oh, yes, I say that.
He was a lowest.
Are we stocking the winners?
You want a gas with it?
I would take it. Yeah. No big deal.
Don't worry. Yummy.
No reason.
Dude, I feel like Dick's is just like secretly good. He's just not telling us. No.
Get up my
You were just talking to I.
Hey,
Oh shit! I got mine.
All they're running the table, bro?
You know it.
Oh.
Then I should have said.
Look at it. Yeah, I got 5.
Why is that in your pocket?
Wait, let me see. 2 in the top.
So what?
Did I start the boys leave already? Oh, yeah, that's true.